All right, we're good.
That's the one. Okay. We're recording. It's 4 o'clock. This is the July 17th meeting of the Nantucket Board of Health. And I want to make sure everyone knows that this meeting is being audio and visually recorded. I think that our first order of business, according to this agenda anyway, appears to be election of officers.
That's correct, yep. So you would have nominations or a motion for electing an officer.
So I think we have to elect a chair,
Yes.
because our chair has rotated off.
Yeah.
And so, well, we'll see. And so I guess we begin by finding nominations for someone to serve as chair.
I'd like to nominate Ann for being chair, moving up from the vice chair position. Oh, I'd like to nominate Ann Smith for the chairman position for the Board of Health.
All in favor?
Aye.
Aye.
Aye, I guess I vote for myself. That means that we need a vice chair,
Yep.
because I don't think I can serve as chair and vice chair.
Seems
Vote.
conflict of interest there.
So how about nominations for a vice chair?
I would like, I would like to nominate Meredith Lepre for vice chair.
Yeah,
Someone second?
Second?
You need a second. Somebody needs a second.
Second, I'll second that.
you nominated her.
No, I nominated
Oh,
her.
sorry. Okay, we good?
And vote.
You,
Yeah.
right? Okay.
All in favor?
Aye.
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 Okay. We did that. Pretty easy.
Good.
Good. Okay. Now this is time for public comment. Anyone in the room or online that would like to comment, please.
Thank you, Madam Chairperson. I'm Bruce Mandel. I live at 10 Midland Avenue in Nantucket. I'm also a board member of the Nantucket Conservation Association, but I'm here speaking as a concerned citizen. As you may recall, at the most recent meeting of the Board of Health with the NP and EDC, a brief comment by the health representative was made regarding the issue of enforcement of non-health related policies, laws, bylaws, and such being imposed on the Board of Health and Health Department. The representative made the point that any approved policy needs a fully approved law or bylaw containing a clear and detailed framework for what constitutes a violation, what are the ramifications of a violation, and which town entity is responsible for enforcement. Without this, a policy is just a request. The enforcement provisions of many recent bylaws, regulations, and such seem to be imposed on the Board of Health Department, including it having the responsibility of being the inspecting and violation enforcing entity. Because of the alarming increase in the number of enforcement issues being thrust on the BOH Health Department, it was stated that there is not enough staffing or time to properly investigate the enforcement of non-health related issues. Staff time is being taken away from health related duties. There's a staffing shortage in order to just deal with the increasingly complex nature of addressing these healthcare and health-related matters. The time necessary for addressing only the detailed and complex health-related issues is a budget drain The staff has not yet been sufficiently trained in the enforcement nuances of non-health related violations, and there are budget concerns. That was part of what was said. Importantly, the part of the representative comments I am referring to today was that with these complex and burdensome requirements, the Health Department, Board of Health, cannot and will not be investigating non-health related compliance or violation issues. So we've got 3 questions for you. Can the staffing at the Department of Health and its budget be adjusted to ensure timely enforcement of non-health related violations? 2, where does a citizen now file requests for an investigation of violations of bylaws, laws, regulations that don't pertain to health issues, but are assigned to the Board of Health? And 3rd, what regulations, laws, bylaws that have enforcement responsibilities have been assigned to the Board of Health where those requirements are non-health related? So we'd like to get answers to those 3 questions. Does anyone have any comments or suggestions?
John, you're in the hot seat. I think a few of those things, this is a concern that we all have. There is no question about that. Thank you for bringing up some of these points. It's very complex, and I know that there was a comment at the last meeting by Rocky that the Board of Health did not have the capacity. Would you like to talk about that a little bit?
Yeah, for starters, the board can't deliberate on an item that's not on the agenda, and this is not obviously an agenda item, this is just public comment. So with that said, as staff, if you'd like to come into our office or write an email, our director is currently out this week, but he will be back next week, and we'd be happy to sit down and go over some of your questions. And if the board so chooses to bring it up at the next meeting, they can do that.
And this is similar to the letter that was in from Emily Kilbert in terms of enforcement in STR that was forwarded to us. So it seems to be a topic that is out there by many citizens that, there seems to be a conflict or, a problem with STR and enforcement.
My recommendation, if the board wants to choose so, would be to bring this up at the next meeting as an agenda item.
Yes, I would say, I would agree with that it should either be, depending on what other items are on the agenda in the August or September meeting.
I understand that you're not supposed to talk about issues like this that aren't on the agenda. But the open meeting law stipulates that a subject that is not on the agenda, that the chairperson feels should be discussed at the meeting, is not a violation of the open meeting law. So under that responsibility, you can discuss this at this meeting.
That would be an agenda item that was not anticipated by the chair within 48 hours of the meeting, so.
That's correct, but the
Yep.
open meeting law says clearly that if an item comes up that the chair feels is important, although it's not listed on the agenda, it can be discussed.
Okay, so 2 things. I think if the board wants to bring this up at the next meeting, I would recommend you do so if that's what you want to do. And second, if you'd like to come into our office and discuss this with our director, we'd be happy to sit down with you.
Okay, do I have to make an appointment or?
Yeah, I have my card here if you want to take my card.
If it would make it easier for me to contact someone, sure.
Sure.
So I can anticipate this being an agenda item at your next meeting. When is your next meeting, please?
It's the third Thursday of every month, so,
Okay, I can figure that out.
okay,
4 PM?
that's correct.
Thank you so much for your time. Appreciate it.
Good afternoon, Curtis Barnes, and to save time, I have distributed to you a request to place the subject of the STR protocol and fees on next month's agenda. So I think that covers it. I've given you all copies. However, I want to note that rental registrations are handled by the health department in Yarmouth and Barnstable. I have been meeting and working with their staff for several years. I actually owned a house in Yarmouth for 8 years that was registered way back then. So as a matter of protocol in the two neighboring communities, the health department does have that responsibility. The second thing I'd like to say is our biggest problem is not short-term rentals. Our biggest problem is year-round rentals, apartments that are overcrowded. I just had to clean out rats and maggots from an apartment on Boynton Lane, not mine. And the fact of the matter is the health department should be inspecting year-round rentals even before short-term rentals. It's long overdue, and I think it is time for you to face up to the fact that we don't register or inspect year-round rentals yet. I think you should be doing it. Thank you.
Well, I think it's clear that this is a subject that is of great interest to many people. The people who've spoken today are just a small drop in the bucket of the people that I've been hearing from. And so I think to put it on the agenda next month so that there will be good participation is a good idea.
Okay.
Can I ask a question of you? So are we saying that we want to discuss this, but also whether or not year-round or longer-term rentals should also have to, I guess, I would think, abide by the same guidelines that the short-term rentals as far as having exit signs and all of the safety, because I think there's been issues in both short-term and long-term rentals of things not being safe and clean. And I feel like as a board, we've heard of those issues with on both types, and that maybe this needs to wrap around both. Is that what we're saying, both of those topics, the fees, but also?
I would think so. If we're gonna tackle it, we have to tackle all of it. It may not even just be, it may be more than one meeting. It may need to continue on into the following month, but it's clearly a big subject and it should be addressed.
Excuse me, as of the last meeting that we had with the Board of Selectmen, it hasn't been decided that we are even going to be responsible for this. We don't know if the Board of Health is going to take care of the short-term rentals. You were at the meeting with me and the select board, one of the select board people said that I was right. They didn't think that the Board of Health had the people or the time or the energy or the knowledge to take care of this and handle it. So as far as I know, this hasn't been given to us yet, and we haven't accepted it yet, unless I'm mistaken. So, I mean, we can sit here and bring this all up, but we still don't have any answers and we don't have any responsibility yet. Am I right?
That's not how I interpret it. I interpret it that for now, and previous to this, it was the Board of Health's responsibility. If there is a vote to change that, then okay. But right now, I think it is our responsibility.
Well, I thought that the select board said at the last meeting, they were right, they didn't think it belonged to us, and they were gonna look for another way out.
But until then, I think, until that change occurs, we are the regulatory, according to the way they wrote everything. And I think we're kind of stuck in that position right now, that until a regulatory change is made, the health department is the enforcing mechanism and the managing mechanism for short-term rentals. So, yeah, that the select board was willing to consider removing it from the health department, I think is a very positive motion, but it doesn't, until that action occurs, tag, we're it. So, and I do agree with Curtis that long-term rentals is really an issue that has been in the background for a long time about, some of the conditions that we've see and some of the crowding conditions, and that we aren't having a lot of oversight over that, and that's probably where there's more negative activity in terms of complaints and violations. But that's my opinion.
So, Madam Chair,
Tom, do you-
oops, unless you'd like to speak, Tom, my suggestion was just if the board wanted to make a motion to put both of these agenda items on next month's agenda.
Yes, sir.
Thank you. Bruce Mandel again. A point of clarification. When we have these discussions, Curtis is and I have, we hear that the Board of Health is responsible for, or the Health Department is responsible for. Those are two separate entities. So when those terms are used in a same discussion, which one are we talking about? Board of Health or the Health Department? You guys are the Board of Health.
We're the board.
But you're telling and talking for the Health Department. Now, who's responsible?
Well, it's the health department that carries it out. We don't go around, Carrie and I don't go around inspecting properties.
That might help with the staffing issue. So,
Yeah, I think it's similar.
in essence, it's the Board of Health is not responsible for these enforcement issues or these short-term rental issues. It's the Health Department.
I think in some ways it's similar how Board of Education is responsible for setting up policies and implementing, and, the bigger picture, but the actual everyday running of the schools really lies in the principals and the people under. And it's kind of, I think the board sets policy and is the legal entity, but the actual following through on policies and actually going out in the field is the health department.
Okay.
So, I mean, there's definitely relationship, but, there is, we're big picture and they're kind of the implementers of the big picture in the small picture way.
Well, you certainly have helped me on trying to understand this. So in all of these discussions, we should be talking about the Health Department's responsibilities.
Yeah.
Enforcing regulations and
Yeah.
policies and whatnot.
Yeah, because I
Is that
mean,
correct?
if we were to continue, if the health department were to continue, it'd be the health department that would be hiring people, not the Board of Health.
And is there someone at the Health Department that would be the contact point?
And that, Rocky is the person, and again, I think, given, yours and Curtis's concern, plus we had received a letter from another person that was in our packet or around our packet, it's a very real issue about what is going to happen with short-term rentals. And again, whether it's the health department and it's in the right place or the wrong place, but it's got to be someplace. It has to be defined, and at that point, we need to then act on if we make rules, we need to enforce them. If we're going to make rules that we can't enforce, and I know that's been a lot of discussion, it's like when we make a rule, we can't enforce it, doesn't do much good. And I think the discussion we've been having about does this short-term rental belong in the health department is really that. I mean, is this the place for that activity? And are we taking it then away from other activities which the health department really may have a greater responsibility and a greater knowledge for? So taking John's suggestion of, we really, I think probably should, I don't know if we need to make a motion or just, it should be on next month's agenda. And I think the background discussion kind of has to start talking about long-term rentals and inspections. I mean, that's, I know no one wants to, because if we start collapsing on long-term year-round rentals and start minimizing the number that are there because of all the violations, where do the people go who are living in those places? And, there's this, which ties to the housing problem. So I know it's one we don't necessarily, a lot of people don't want to touch because we know that it's going to be a tough discussion, but I think it's time to open up the box a little bit and see what are the issues and sort it out, start sorting it out.
Well, these are complex issues, and it almost sounds like an accident looking for a place to happen.
I think it happens.
So I hope you can sort this out with some public input. Thanks.
Okay, thank you.
So can I make a motion for us to discuss those next month? Excuse me, to be put on the agenda for next month?
Now a second.
All
I
in
guess-
favor? Yeah.
Aye.
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 Madam Chair? Could I ask for a tiny bit of clarification on which specific issues? Because there were about 5 or 6 issues that were raised through that. Oh, I'm sorry. This was more specifically, the STR regulation question and the long-term rental inspection process. There were a lot of issues that were raised during that.
Yes. Okay. Goodness, we haven't even approved the minutes yet. Can we go on and do that? Is there a motion to approve our minutes from the June?
There were 2 small corrections, in terms of people's names, that I sent to Tamika, just about, it was David Copper, was this David Cocker, and, okay, that was the only thing in the minutes. There was another error in names, but so that was the only thing I saw that, that was David, that the person who presented had a different name than what was written.
Okay, can we approve with those corrections?
And just so I'm clear, Madam, that's the June 12th minutes, correct?
Yeah, yeah.
Yeah,
last
we
month.
met at a little out of order because of,
Right, yep, okay.
And Tamika has the correct names.
Motion to approve the June 12th meeting minutes?
A second?
Second.
all in favor?
Aye.
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 Madam Chair, I'm going to abstain from the vote since I was not present.
Yeah,
Thank you.
Okay. Okay,
And then, Madam Chair, there was also minutes from June 18th. Was that the select board meeting?
Oh, yeah.
that was the 12th, was the 12th the joint meeting? We have 2 meetings?
The
The joint meeting
The
was
joint
June
meeting.
18th,
June 25th.
June 25th, I'm sorry.
And I'm going to abstain because I was not at that
Yeah.
meeting, but I did watch it.
And
To
I'm
get
going to
up to
abstain
date.
because I didn't watch it, nor was I at the meeting.
Well, then I guess we can't really,
Well, you know.
there's Tom,
But I was on the other side of that. So
Yeah.
I wasn't a board of, you're approving the Board of Health minutes. So you can vote on that. And since, even if you weren't there as board members, it's just, I wasn't on the Board of Health, so I can't. It's up to you. Your
All
call.
right, motion to approve June 25th, joint select board, Board of Health meeting minutes.
I'll second it.
all in favor?
Aye.
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 Fine. All right, I think they're approved. Is that all our housekeeping?
I
John,
think
did
that's the housekeeping as of now, yeah.
Okay. So now, number 5 is the thing that we've been so looking forward to for a very long time, which is this report, everything, we're going to find out everything that we have always wanted to know about IA systems, and so take it away.
Yeah, so
far
I
as I'm-
think we're lucky enough to have George present tonight at the meeting. He's with Mass TC, Massachusetts Alternative Septic System Test Center. I've had the chance to hear George speak a few times at several conferences, and it's always enlightening to me. So I'm excited to have him, and thank you, George, for being able to do this.
Okay, can everybody hear me?
We can.
Okay, I have a short presentation, and I'll sort of whip through the presentation this afternoon and then save most of the time for questions because it's a large topic. And I think your health agent knows I could go on for 2, 3, 4 hours. He's only given me a short time here, so I'm going to zip through and I'll share my screen here and see if you see it. Do you see it?
We do.
Oops, yes.
We can see.
Okay, so you have up before you something that says innovative alternative septic systems?
We do not.
Not
Looks
exactly.
like a mushroom, George.
Okay,
Yeah, but-
that's what I thought. Okay, so I need to see how to share that mushroom, by the way, is growing in my backyard. Okay. See, I don't use Zoom much, so please bear with me. Share. I might have to move this over here like this. Try to share that. You see that? No.
Yes.
Yes, we can see it. We can see it.
Okay.
There, that's bigger, that's better.
Okay.
That's even bigger, better.
Let's see. Slideshow, and I'll start from beginning. So you still see that?
Yes.
Yes.
Okay. So innovative alternative septic systems. Want to go briefly on what are they? When do you need to use them? How they're permitted and approved, what the role is of Board of Health, and what you need to know in relation to Title V. I'll say as a background, I've been on a Board of Health and continue to serve on one for about 30 years. We're grappling with many of the same topics I just heard you folks discussing, which is kind of interesting. Almost wanted to continue that discussion. But innovative alternative septic systems I've worked with for the past 40 years here at the County Health Department, starting the Alternative Septic System Test Center. So what are they? Basically, innovative alternatives in our area, the main focus is for nitrogen removal. There are lots of things you can do with alternative septic systems throughout the state. They're used to reduce leach field sizes. They're used to address some challenging conditions. But in our geological setting, the difficulty is nitrogen. We're sort of loading it into our embayments. We're loading it into our watershed areas used for drinking water. And that's basically the primary focus of alternative septic systems on Cape Cod and the islands. The systems themselves are fairly simple. They just manipulate the nitrogen cycle, and that's pretty easy to know. We eat plants, we poop, we pee, it goes into the leach field. It goes, some of that will be denitrified in a natural leach field. About 20 to 30% will be denitrified. Nitrogen will escape into the atmosphere. It'll come back down, be fixed by plants. We'll eat it and do the whole thing again. As far as a challenge, nutrients, particularly nitrogen, is about halfway up the big challenge. Title V used to be primarily a disposal code in 1995. It sort of became a treatment code because we realized that we were befouling our water supplies and, of course, the natural embayments, particularly the marine embayments, our ponds. So somewhere uh, they decided to move it toward a treatment standard, which is why in 1995 the code changed quite drastically to reduce loading rates that would improve stabilization of the waste and the removal of pathogens and bacteria. But at that time, that was 1995, there was little concern or less concern about nitrogen. It was there and everybody saw it as a coming topic, but they really did not address it in the code as far as requirements. The role of the Board of Health is today is to apply these technologies to protect water supplies, surface waters, as specified in Title V for the protection of public health and the environment. And you've been board members for any amount of time, you know that primarily on Cape Cod and the islands, the major focus has been Title V. And off Cape, you'll see where there's sewering. The issues range from other public health concerns, but I don't know about your meetings, but about 90% of meetings on Cape Cod Board of Health are concerned about Title V and the enforcement of Title V, approval of plans, variances, and things like that. So the role of the board, of course, is to protect public and private wells, ponds, lakes, and estuaries. What happened to the changes in Title V? And this is really a quick hand view of it. The protective measures for drinking water that required or only allowed 440 gallons per acre on residential, those basically stayed the same. The nitrogen sensitive areas, or NSA for marine environments, are required in the new code. And that basically says that if you have a watershed that's being impacted or a marine embayment that's being impacted, the watershed plan states in it that there's a TMDL, a maximum daily load of nitrogen that can be taken and not represent a public health or environmental hazard. That's called a TMDL, a totally maximum daily load. If that is determined and DEP has issued it, EPA has approved it, then it sort of changes the game. It's now a new nitrogen sensitive area. Also, town entities, municipals can call a nitrogen sensitive area, can actually say, you know, we know this is nitrogen sensitive. It's not really on the list from DEP as it is in many of the places on Cape Cod. But the Board of Health, as you know, the local Board of Health can pass regulations that are stricter than Title V. They cannot go anywhere lenient of it, but they can have more strict regulations. The other thing that came into the code was something referred to as best available nitrogen technologies, or banner, we call them. There's a list on DEP's website which lists about 4 in the top sort of tier of nitrogen removing technologies that can be applied. And these are primarily being applied now in NSAs for marine waters. The NSA that is your well protection area, your zone 2s, or where there's private wells on the lot where there's a septic system, that pretty much stayed the same. They don't require banner best available nitrogen technology, but you do have to have one that has at least a 50% removal of the nitrogen. So boards of health are kind of faced with, particularly on Cape Cod and the islands, with, you know, how do we know what works out there? There are a number of tools that any board can avail themselves to, and even the public can. For instance, your town is within the tracking area of our um, alternative tracking mechanism, in which people who have alternative septic systems in Nantucket report their results to the Barnstable County Health Department system. And that data or those data are available to you and to the general public. Now, they're sort of anonymous, so you'd see as you look at the data, you can't tell, oh yeah, that's Harry's house right there. It says right on the label. But you could see what it's doing in your town as well as Cape Wide. This tracking system, as I said, is publicly available. It's on the website for Barnstable County Health Department. And a lot of folks check in to see how a particular technology works before they buy it. Most engineers, as you know, have their favorite pet system that they put in when they're required to use nitrogen removal systems because they're used to it. But there's becoming increasingly, the public is increasingly aware that some of these technologies work better than others, and they want the better technologies or the cheaper ones. So whatever you're looking for, this website will tell you what that particular technology can do. If you check onto this site and you go to the data and statistics, you then are brought to a screen which you're able to select what technology you want to look at. If you click on one of those boxes, it will bring you to some information on the technology as far as who the vendor is. You can contact them, you can get pricing information, things like that. More importantly to the folks, you, for instance, from Board of Health, is are they meeting the standards that they should? So if you click on one of those, you'll be asked if you want to look at the data. If you want to look at the data, that's what it looks like. It's a little hard to read, but that little line going across the blue line is 19 milligrams per liter, which represents, uh, actually represents more than 50% removal, but the state assumes as sort of a real conservative estimate that that's 50% removal. And you can see, for instance, this particular technology, if you hovered over any of those little dots there, it would tell you what percent reaches, say, 19 milligrams per liter, what percent of those systems. You can see from these data that those on the far right, those are all systems that are not in compliance with the 19 milligrams per liter. Now, Board of Health, when they find that out, has a choice. They can go after the people or the operators of those systems and say, look, you are supposed to meet 19 milligrams per liter. We want to protect our water supply. You're not meeting it. What are you going to do to meet it? I will tell you from the Board of Health standpoint, we have passed in Falmouth a regulation that requires the operators to come in with a plan if they're out of compliance and tell us how they're going to bring it back into compliance, or alternately, they could show us through a procedure that's outlined in our regulation to say, look, if you give us this information showing that you get 50% removal, then we will allow this system to continue. And you say, well, they're not meeting 50% according to the graph. Well, the one thing you should realize is that many of these technologies, you cannot tell the percent removal simply by looking at the concentration of their effluent, which is on this graph. The only way to really tell is you'd have to know the influent. And a lot of folks don't measure the influent, but folks that are out of compliance in the town of Falmouth will bring those data to the table. They'll have the operator go out and collect an influent sample if possible. If they can't, they'll show us their water use records, which indicate they're very sparing with their water, so their concentration of nitrogen would be much higher, and therefore 50% of 100 would make it 50. Uh, However, 50 is way over the 19, which is on their permit. So they would say, well, look, we concentrate our wastewater because we're very frugal with water. And you wouldn't want them to be in compliance by just saying, okay, well, go home and use 5 times more water. That will get you there. You don't want that. So we have a mechanism in the town through our regulation, be glad to share it with you, that says, if an operator is out of compliance, here's how they can show the compliance to the spirit of that regulation versus just saying, okay, you got to rip this out and put in a new system. There's also on the state list, mass.gov, there's a lot of good information on the technologies. For instance, the best available technologies that we have just talked about, they're on this list. You see the second thing down. If you clicked on that, you would see the best available technologies under these general, provisional, and pilot use approvals. Now, there are very few that have general use approval for like below 10 milligrams per liter. In fact, there are no general use approvals. Those are all provisional use. So you as a Board of Health can allow that in your town if, for instance, you had an embayment that was very impacted and somebody came to you and said, well, we have all these variances. We want to put in an extra bedroom or something like that, or our system has failed and we want to upgrade to something that will protect Nantucket Harbor, Inner Harbor. And you would have to, at the local level, allow them to use a provisional use banner or best available technology, because the ones that are the best only have provisional approval. There are a couple general use approvals. In fact, the Septitech is out on Nantucket quite a bit. These are the records from the website, this is DEP's website, to show you there's 80 plus systems there, and 85% of them perform to 19 milligrams per liter. If you needed more, like you wanted 10 milligrams per liter, you can see from that graph, probably about 50% of them would meet that. You could find out the exact percentage if you checked onto the Barnstable County's website, because you can hover over the number and it will tell you exactly how many can reach that 10 or 5 or whatever you set for your local standard. So this is one of the banners, the best available nitrogen technology. It's very popular out there. The Advantex is another one. They have, it says 67% of their systems meet 19 milligrams per liter. The Nitrex, they have a different standard. Their standard is 10 milligrams per liter. And according to this, which I don't know where the state gets the data for these 10, because I haven't found 10 in our state, but they say they have 100% performance at 10 milligrams per liter. And Nitro, a system that was sort of invented by somebody over on Martha's Vineyard, they have pretty good record for 19 milligrams per liter, as well as they're trying to get down to 11 milligrams per liter. So the short story is, if you're concerned about nitrogen as a Board of Health, you really should focus on the technologies that work best, encourage their use, particularly depending on whether somebody's coming in for a pretty egregious variance. You want to get something back, because think about this, as a Board of Health, when you grant a variance, you are granting a relief from a regulation or a law that is protecting the public health. you're granting a variance to that. So it's incumbent upon the person who wants to violate that or to get some relief from that particular requirement to give something back. There's always a trade back from the from the public health. If somebody says, "Oh, I'm close to this wetland," and that wetland is attached to a shellfish area, you say, "Well, look, you're impinging upon the public health. So what are you going to do to, take some of that sort of risk back?" And usually that's done with an alternative septic system, something that treats for pathogens better, something that treats for nitrogen better. So is nitrogen the only concern? Clearly, it's not. Nitrogen is a fairly easy thing to remove from wastewater. It can be very expensive. It's not like falling off a tree or a truck. You really have to have some mechanical system that does it. It's not usually a natural system that removes nitrogen. But the next steps up are nutrients like phosphorus and, of course, contaminants of emerging concern. And really, when contaminants of emerging concern, you should understand that even treatment plants don't really treat for a lot of these. We did a lot of work here, for instance, and found out that very shallow play systems like drip disposal, drip dispersal, and shallow systems, technologies that discharge into the A and B soil layers, do a lot better job at emerging contaminants, but none of them are particularly great at removing things like fire retardants or PFAS. PFAS is sort of a newer player, and we all have probably heard about it. You should, because there's some surging through your body right now in your bloodstream. They say that about 95% of people, you have detectable levels of a PFAS in your blood right now. Uh, it's still a long way from, we're a long way from understanding what's going on, even with septic systems. The origins of those are many. They come from fire retardants, resistant clothing, treatments for furniture, you name it. I mean, I don't understand why we create so much. I mean, it's the nonstick pan everybody sort of focuses on, but it is everywhere. It's in our personal care products. It, of course, is in fire retardants and things they used to use for putting out fires, foam. That foam, by the way, there's been programs for years now, firefighting foams for replacement in your fire department. I just learned that the Falmouth Fire Department is replacing all their old foam with non-PFAS foam under a grant from the state. So the problem with PFAS is that it's everywhere, and that sort of carbon fluorine bond is just tough to break. And the curse with them is the fact that they're hard to analyze for. We did a little work here with some of our wood-based treatment systems, and we found out in raw wastewater, look at if you see in the lower portion of that graph, there's hardly any PFAS, less than 20 nanograms per liter. But if you look in the leachate going to the leach field from many of these treatment units, you see there's more PFAS in there. Now, the fact is, there's really not more. It's just as you go through treatment and you oxidize those compounds, they're now measured much more. They're much easier to measure. So the measurability of PFAS components increase with treatment, but the raw wastewater contains quite a bit of them. And, we've known this for years. I think if you are here in the Cape, you've heard of Silent Spring, and out there, they're probably giving you some talks on this, how many contaminants of emerging concern are in wastewater from different treatment units. Even if you look at this particular publication, they even compared them with large wastewater treatment plants. And again, particularly with fire retardants and PFAS, there's very little treatment. TSEP, trichloroethylene phosphate, some of the plasticizers, they're they just they're everywhere. You know, we've dug a big hole. We've dug a big hole and left the ladder in the garage. So we have a long way of our understanding of PFAS chemistry. Uh, I don't think we can reasonably expect that there's any treatment technologies out there, particularly on-site treatment technologies, that are even going to put a dent in them. I think the key to getting rid of PFAS and wastewater is the policies at the federal and EPA level to restrict their use in a lot of our common things that we use. There are a lot of European countries that really cut back on the PFAS. Some don't even allow it to be used. And as you probably know, PFAS in wastewater sludge that's pumped from your septic tanks used to go to places in Maine to be spread on the land. Maine has shut us off now from that because they're finding that in some of the foods that they fertilize with the sludge. New Hampshire has. Right now, the only option in Massachusetts is to burn it. And we drive all our sludge down to Rhode Island. I don't know where you folks are getting rid of your sludge, but I'm going to imagine that if you have a treatment plant, the budget for that sludge that comes from the treatment plant and the sludge that's coming from your septic tanks, those budgets are going through the roof. I mean, we're almost seeing doubling of costs from that from the past 5 years. So that's a real quick run through IA systems, and I know I went very quick. So I wanted to leave plenty of time for any questions that you might have about, IA systems, where they should be applied, what your local regulations are like, things like that. So, open to questions. Anybody? A hush came over the pool room.
Well, I'll start because, as you alluded to, George, this is a topic that comes up literally at every meeting. And I was interested to see that there are certain technologies, certain systems that appear to be much more effective than others. For a person who is replacing a system because it has failed, their old system, because it has failed, or because they're in a delicate zone where it's required, can we mandate that they use one of the more effective systems?
Yes, you can. You have to be very careful how you mandate any particular system. You can require a certain level of performance. Now, let's say you're just concerned with drinking water. So the drinking water standard of 4 bedrooms an acre, 660 an acre if you have an IA system, an alternative septic system. That assumption was made that those systems placed in that area get 19 milligrams per liter. You can insist on that even in a repair. So you could say, okay, I've got a half acre, I've got a 3-bedroom house on a half acre. I really should only have a 2-bedroom house on a half acre if it was according to, and I'm in a water recharge area for public supply well. Upon repair, you can insist that they do that. That would have to be a regulation in your town and a policy of your Board of Health, but you're well within the right to do that within a water recharge area. Now, you can once that's required, you can insist on the results meeting 19 milligrams per liter. And if it's not, of course, they could be subject to enforcement action by the Board of Health, because if they don't meet 19 milligrams per liter, you can compel them by regulation to replace the system with something that gets 19 milligrams per liter. For instance, System X goes in, they say, oh, I really want to use this system. It's cheap, it's easy, and they have a general use approval for nitrogen removal. The system goes in, it's being monitored. Remember, you are not allowed to just not, you must require monitoring within your zone twos for IA's innovative alternatives applied under this regulation. So let's say they come back and they can't meet 19 milligrams per liter. Well, there are a number of things you can do. And your Board of Health, you know what it's like. Joe's sitting in front of you saying, I'm trying as hard as I can. I can't get this thing to get 19 milligrams per liter. You can work with, or you should work with the operator of that system to tell you why it's not meeting that. Sometimes they're not even have the system on. And the operator may say, look, I go to the house and I can't do the maintenance because the system's never on. Of course, then your enforcement would be against the homeowner. If the operator says, look, they're doing everything they can, I can't figure out why this thing isn't working, then you've really got a tough nut to crack there. You've got to work with the operator and the owner to find out why it's not working in your water recharge area. Sometimes it's something that needs to be added to the system. For instance, on Cape Cod and out on your island, what happens is that they can't denitrify very well because they can't nitrify. So the data are showing a lot of nitrogen, however, it's all ammonia. Then we have a little book that'll tell the operator, look, here are the things you should try. One, is the air going? Two, is the alkalinity appropriate? You might have to add baking soda to that or some sort of carbonate to it to allow it to nitrify so it can denitrify. We went through this in Falmouth a lot because we have a lot of recharge areas, and we developed sort of helps for the operators who come into those situations. If it's an owner that's just won't let the thing be powered up to it, then the enforcement action clearly should be against the owner. The operator says, look, I've been there 4 times, bad results every time, but I always have to tell a person, keep the thing plugged in. You know, a lot of these chew up some power, and I'm sure, you know, homeowners don't like that. But if you've given them a variance to be in a water recharge area and have that extra bedroom, I'm sorry, they have to be in compliance. That's kind of the tough road the Board of Health has to sort of walk on.
George, Carrie McKenna, one of the board members. First, thanks for doing this. In reading one of the other supporting documents that you've developed, there was I'd heard it before, but then when I saw it in your stuff, that about seasonal use and the inefficiencies of some of the IA systems that we're using seasonal use, and then the amount of time it takes for them to kind of get up to the appropriate and what they should be doing in terms of denitrification. What strategies have you used on the Cape to help address that?
Well, you know, depending on what kind of sensitive area you're dealing with, if you're in a zone 2, you're a little bit more, should be a little bit more strict. But I always say this, if you've got a house that's in seasonal use, you generally have about a 75% reduction of nitrogen by virtue of they're not being there 75% of the time. But when they are there, you want it to work. So there are ways, and there are certain technologies that are more robust to starting up quickly. For instance, a trickling filter like Advantex or Septatech, they'll come up to speed rather quickly. Like within 3 weeks in the summer, they'll come right up to speed. But if they're not there for 6 months of the year, you don't have any nitrogen going in. So 6 months of the year, you got a 50% removal right away. So I'm not as concerned about the lack of quick startup on these systems. The ones that are trickling filters, like those two I mentioned, those are more robust and they start right up. The ones that are not, these would be fixed activated sludge or fast systems or Singular, some of the others. There are strategies to get them going before the people come down. Their operators should be, for lack of a better word, feeding the systems. They might have to add some carbon to them, start them up, because some people shut them down in the winter. The power's off in the house, they shut them down. The startup of that should involve going out there prior to the people coming, making sure that everything's working, the air blows, the air pressure, everything's working. So that's how we address it. If it's truly a seasonal home, I say, well, that's great. I get at least 50%, usually 75% removal. And then I look at the technology, and their first reading in June might be pretty bad, but sometime in July when they take their second one, because we require 4 per year. If it's seasonal, we require 2, and they must be 30 days apart. So they take the first one in June, it's good, or not good. And the one usually in July going into August is usually right back up to speed. And then they're gone in September through the next time they come down in May. But we found that trickling filters are a little bit more robust to that seasonality. And that's how we handle it. And as far as requiring it, somebody will come in and say, well, I'm in a zone 2, but, I'm a seasonal home. So I really, well, you don't know when that's going to go from seasonal to year round. So to require it in those situations, just because they say right now they're seasonal, I think you'd have to really require the 660 an acre or 440 an acre in your zone 2s, because your drinking water is where you want to be the most protected.
Thank you.
How do you feel like I guess I struggle with these with like going from 8 bedrooms to 12 bedrooms, and that feels like that's still a lot of pressure on the environment. Even if
Yeah,
is an AI system, it feels like I don't really know why anyone would need 12 bedrooms, but that's my personal feeling. But I feel like we get a lot of these that are, developers coming, and I struggle when they want to pull up a system that is working because they want the extra bedrooms, or when they just want to put in this because they want the extra bedrooms. It's not really, I wouldn't say they're necessarily all because they are feeling that they're doing something so good for our community and environment. How do you guys deal with that?
well, it's what's the difficulty is that we're a board of health and we cannot impugn upon somebody who comes before us with the request why they're doing it. So if you back up and somebody says, geez, I've got 8 bedrooms in this house and I have a standard system, I want to put 12 bedrooms in this house. First thing you have to look at is what area you're going into. Is it a sensitive area? Is it, nitrogen sensitive area? And they say, look, we're going to give you an IA system here. This is the best thing since sliced bread. That's possibly a bad metaphor. But we're going to give you a great system, and it's right on the top of the banner list. And we want our 12 bedrooms for whatever somebody wants 12 bedrooms for. I'd usually suspect that that's going to be more commercially used. So I would insist upon the best available technology. But we can't, land of the free, home of the brave. People want to use their property. They're going to give you the best environmental protection unless there is a compelling and science-driven reason why you need to get down to a certain concentration of nitrogen coming from that lot. And you know that that technology will or will not get it. Uh, Unless that science is there to compel them, we have to allow it. Can you fit on the lot? Does it make zoning? Does it make whatever? Is it in a protective area? If it's in a protective area, then you can say, okay, this is what we need to insist on as far as the discharge from that. Now, we have in Falmouth, we've said that all our banner areas, all our nitrogen sensitive areas that are marine waters, we say they must make no more than 11 milligrams per liter. We don't tell them what technology, because they may say, oh, I can do it with this technology. Fine, but just realize if you don't do it with that technology, you will be replacing it. And they agree to that. The developer always agrees to things he hopes to get or she hopes to get, but you hope they're not going to leave this to some unsuspecting person who purchases property thinking, oh, okay, gee, I got 12 bedrooms now. I can just, you know, do an Airbnb here for 12 bedrooms. So it's tough. I've been on a board now for at least 35 years, and everyone's different. You get them before you get the person who's just trying to make that thing work. He's 3 bedroom or she's 3 bedroom or the family's 3 bedroom on a half-acre lot, and now you're going to make them put in an IA system. They're, they're barely scraping by now. You try to get them, the septic loan. We have a septic loan program over here, so you try to get them into that. But that's different than the person who comes in, buys, rips down the house and says, hey, there were 4 bedrooms, now I want 6. Uh, for those, we sort of lean into the wind there and say, no, you're going to have to use Banner for that. Again, you don't specify any one technology. We specify what they must meet as a nitrogen standard. And generally that's 11 milligrams per liter. That's what we say in all our decisions. Is
Thank you
your
so much.
is your primary concern out there your drinking water aquifer, or do you have any marine environments that have TMDLs for them?
I think we have all of that. Yeah.
I'd say
Both.
both of
Yeah.
those things, yeah.
I mean, we have a drought right now and a sole source aquifer that has definitely got PFAS in it, and it is popping up in many places. And a lot of these are in areas that a lot of these variance requests we're getting are in like recharge areas. And so I think that there's a big concern about all of it.
Well, with the recharge areas, I think you should really sort of focus in on recharge areas, public supply wells, really focus in on the protection there. And anytime have decisions, of course, one of your findings should be that this is a sensitive area and a drinking water aquifer. Therefore, your requirements are going to be stricter. We hold the line very sharply on that. Any new construction in there, no variances. We have a fairly strict no variance for new construction. And I think that's borne out in the code and allows you to look at variances for new construction under a much stricter sort of microscope. You look under that, and we even look at variances that are fairly minor variances for new construction. We say, I'm sorry, that sideline variance, you could just make the house 2 feet shorter and you'd meet that. You wouldn't need a variance. Um, but it's tough as a Board of Health, I know. We've, we sit twice a month and we get, probably 4 hearings every time we meet. Title V hearings.
George, one of the, and I just kind of taken off from Meredith, that, our discussions a lot of times have been, each variance by itself looks okay, but looking at the collection, that little by little, we are essentially destroying our aquifer. And then the other thing that relates to that is you were talking about nitrogen, but also, there is other pathogens and stuff in the effluent, and and just looking at one of the statements that nitrogen removal technology may provide environmental benefit, but it does little to address more important issue of pathogens. So I guess those two thoughts kind of run in the background of a lot of our discussions.
I think with the discussion of pathogens, in fact, we're in the middle of just completing a fairly comprehensive study of Title V requirements, and that being the setback distance to groundwater. And what we've found that the 5-foot separation is extremely efficient at removing pathogens. And we've done it with viruses. We just looked at 3 human viruses. We did it with phage viruses just to see, because there's at least 120 human viruses, and you can't measure them all. So we used a phage virus, bacterial indicators. So if you hold to the 5 foot to groundwater on your leach fields, you are protecting from the pathogens. It's the other things that are much more insidious. It's, the nitrogen, of course, because once it's at nitrate, it's free to go wherever it wants. Phosphorus is a little different. That gets bound up in our iron sands pretty well for at least 5 or 6 years before it starts breaking through. But I'm concerned about that with freshwater ponds. I'm on the ponds committee there in Falmouth, and we're working with fertilizer regulations. Good luck with that. Oh, in fact, we're looking at your regulation for fertilizers. That came up at the last meeting. And I really feel your same concern. 1 variance, 2 variances, you say, okay, but once you start adding up the many that you give, that means that you as a board should start thinking about wider issues and more strict regulations, given the fact that you have been granting a lot of variances. If that's the case, you say, geez, we're always granting these variances and we know we're ruining our groundwater. So why don't we require better technologies for nitrogen? And as we said in the beginning of the meeting, you can require that, but it will require you to have a regulation and pass a regulation requiring it. And we're in the midst of it right now, passing regulations for tighter requirements. We have some, but now that DEP is leaning on us for our 14 abatements, we're really starting, for instance, all new construction, doesn't matter how big your lot is. If it's in an NSA in one of the watersheds for an impacted water body, you're going to have to use an IA system, and it has to be on the Banner list. So you can do it. You can require more strict regulation, and you can require the better performing technologies. So just need to do it. Just need to write the regulation and do it.
And you don't allow any variances on new construction?
Correct. I think the only time we've ever granted a variance on new construction is variance to a reserve area. I mean, because technically, and we went through this with Brian Dudley when he was with DEP Southeast Region. Uh, it is the only variance we've granted because somebody could say, well, we'll just dig this up in place and put a new one right in its own place. We'll replace all the fill material. And we thought, okay, yeah, you could do that. Um, but we did not want to stand against the legal challenge of somebody who would take that all the way through the courts and come up with that. Every other variance, you could say no. I mean, remember, here's a variance. There's two things they've got to prove. They've got to prove manifest injustice. Will your denial of the variance manifest injustice? On new construction, that's a pretty tough thing for them to prove because the courts have all said that manifest injustice is when you deny somebody to use any reasonable use of their property. So we have somebody comes in, they're in a small lot, and they have this 6-bedroom design, 6 bedrooms, and they need a variance, a sideline variance. We say, no, you can't have it. Will we manifest injustice? No, because we say there's an option here. You can make the house smaller. You could fit that on there. And we've never, I've never worried. I've gone to court for towns and testified for towns that say, no, of course it's not manifest injustice because they could have made the house smaller. They just didn't. So, yeah, no variances for new construction.
Madam
And
Chair.
I think the board really, I don't know a board of health out there that has been challenged and not won that one because usually the applicant could reduce the size of something to get it on the lot. And reasonable use of the property is defined as any reasonable use, a 1-bedroom house, a 2-bedroom house. And if you want a 4-bedroom house and you can't fit it without a variance, I'm sorry, it's going to be a 3-bedroom house or a 2-bedroom house because you could fit that system in there.
Madam Chair. I asked George a question. George, thank you for being here today, bringing your expertise, many decades of knowledge. Tom Dixon, newest Board of Health member and Nantucket Select Board member. I have a question on the 11 milligrams per liter that you require.
Yes.
Was the emerging contaminants part of that, your thinking on that it would reduce that? And kind of, do you have any thoughts on how the future of Title V and what regs come down from DEP, et cetera, and Title V are going to change around these contaminants?
I think that that's like one thing that Title V will never touch is the contaminants of emerging concern. There are some general principles you should know that a system that is more aerobic, like a treatment system or a well-designed leach field, will remove contaminants of emerging concern better than the old systems that used to just hyperload small areas. We used to have leach pits, cesspools, those hyperload. I mean, the loading rates on those were like 3-4 gallons per square foot per day. Today, the loading rate is 0.74 gallons per square foot per day in sandy soils. But still, that does not get rid of all the contaminants of emerging concern. What washes off our clothes, TSEP, for instance, trichloroethylene phosphate, not touched by any of the bugs. We are finding, that given enough time, nature will take care of what we throw at it, but it takes its own time doing it. I don't think DEP will ever address that in on-site systems. And I severely doubt that even large treatment technologies, wastewater treatment plants, are going to either. I can show you the data that, for instance, a shallow system like a drip system will remove more contaminants of emerging concern than most of the treatment plants out there. And that's just a very simple technology. It's 6 inches below the ground. It's in the AB layer, so the soils are tighter. The system has to be a little bigger in those areas. I don't know what your overburden is out there, how many, like we typically have about 2 feet of sandy loam, loamy sand on top, and then you get into the coarse sand. What does the engineer do? Designs on the sand. But if you took those top layers and you put a drip system in or a shallow distribution system, you do much better to remove the contaminants of emerging concern because they usually are tied up in the finer sediments. The plants and the plant roots have some enzymes that break some of those things down. But in answer to your question, I don't think DEP is ever going to change a code in relation to a contaminant of emerging concern because there's so many of them, and their particular breakdown requires, enzymatic activities that, don't exist in a septic system. We have seen that some of the wood-based systems, like the nitro, the nitrex, and some of the non-proprietary ones we're playing around with, they remove some more of those contaminants because in order for them to denitrify, they have to break down lignin and cellulose. Lignin is just the worst compound to try to break down, but there are fungi and bacteria that can do it, and they're in wood-based systems. So they work a little bit better than the standard system, but still, you get something like PFAS, that stuff's screaming through. It's just not going to get tied up. I think the only thing that I've seen totally destroy it right now, although, I'm always looking in the literature for the next bacteria that can do something. But right now, pyrolysis and gasification is about the only thing that can get rid of PFAS and requires some pretty high temperatures and pressures.
Got it, thank you. And Falmouth is a very large community and has Woods Hole and then the whole part towards Bourne, which is massive. And if I remember correctly from my days in working for our state rep's office, only about 10% of Falmouth is sewered, if I remember correctly. So I think you have quite a number of septic systems like we do here. Is that correct?
Yes, yes,
Yeah,
we
so-
do. But they have a wastewater plan that includes a lot of sewering. But like north of 28, Route 28, they're not going to ever sewer that. Wacoit Bay is going to be a long time before we get there. So people out there are insisting that we start thinking about requiring IA systems. In our last Board of Health meeting, which was this past Monday, we discussed the rule for IA systems for all new construction.
Thank you, sir.
Madam Chair, if I might make a
Yes,
comment.
John.
George, so I think just a quick background of as you're familiar with local regulations, our wellhead, Zone 2, the local regulation as it is with Title V, 1 per 10,000. And then most of the variances that are presented before the board are for variances for our local regulations. So the variance requested in the wellhead would be for bedroom credits on using IA systems. That's one of the bigger, when we're talking new construction, that's the biggest variance that we see presented to the board. And in the past, the board has granted some of those for many years. We do have two areas, which I know you're familiar with, Nantucket Harbor and Mattocket Harbor watersheds, which do have TMDLs with
TMDLs,
Mass DEP. And as we know, probably in a few years, Mass DEP will be requiring We already locally require the IAs in those scenarios, but, I guess in a few years, Mass DEP will mandate that anyhow. So Nantucket and Mattocket are actually more stringent really locally than our wellhead district. So where it's strictly 1 per 10,000 with an IA system in Mattocket and Nantucket. So I just wanted to kind of touch base that these are really local regulations, which are for the board to consider when they're presented.
Yeah, in those areas, I would insist on off the Bannert list. You wouldn't be able to apply 19 milligrams per liter in there, 1 bedroom an acre, because as you understand, 1 bedroom an acre, where that came from is they really didn't want to exceed 5 milligrams per liter at the boundary. So they took all the rainwater that could come in, the dilution, everything, and they said, okay, in order to do that, you can't put more than 440 on an acre, 440 gallons on an acre. If you could remove half the nitrogen, then you could put, 6 bedrooms on that acre. Well, that's for wellhead protection for 10 milligrams per liter. If you gave most marine environments 10 milligrams, if you gave them 19 milligrams per liter, they'd blow out so much you could walk on them and not be divine. You'd be walking across algae mats. So the restriction in those areas that have TMDLs is got to be a lot stricter than 1 bedroom for 10,000 square feet. So that's why we're going to, in our areas, we know that a lot of half-acre lots are in those areas of critical concern for us. They have the TMDLs. So we're not going to let them put a system that only is approved for 19 milligrams per liter. That's where we came up with the 11. And by the way, why we used 11, you say, well, 11, that's an odd number to use. Because the two top Bannert systems, one can remove it, is seeking approval for removing down to 10 milligrams per liter, and the other is to 11 milligrams per liter. If we insisted on 10 milligrams per liter, then what basically we would be doing is telling them they could only use one technology. By putting it at 11, there's two systems in that category. So that gets back to what I mentioned before. You can insist on a certain discharge limit, but you cannot insist that they use a particular technology. If somebody comes to our board and says, look, I think with this particular system, I can get down to 10 milligrams per liter, even though it's not on that Bannert list, we'll say that's fine. However, you need to sign this thing that says, should you not get it, you're yanking it out and putting this other one in. So generally at that point in the discussion, they drop the idea of using a technology that costs $15 off eBay to get their 10 milligrams per liter, because they know they're going to have to rip it out if it doesn't work. So in those areas, it's appropriate to absolutely insist on Bannert and make it known to the engineers that's what you're going to do. But in your wellhead protection areas, I think there's a wider range that can meet 19 milligrams per liter. But caution there, make sure they're doing that. Make sure they're meeting that. So you can check, I think, if you're on the county system, you can have the health agent check any particular property to see what their record looks like. In fact, one of the services we offer, we mail boards of health people list of people who are out of compliance to that 19 milligrams per liter. And then, of course, the board, we don't exercise any authority. We give the information to the board, and the board decides what to do with it. In Falmouth, we call those people to the board meeting to show cause why they can't meet 19 milligrams per liter. Yes, it's a pain in the neck. And you're right, we have a lot of septic systems in Falmouth, but we decided to do that. And as we decided to do that, more and more people got in touch with their operators to say, hey, I'm paying you good money, get my system to work.
George, could you review one more time for us the circumstances that you would insist on 11 as opposed to 19?
That would be in your areas where you have a TMDL and it's nitrogen sensitive area for marine waters, and you have two of them. And in your zone twos, you might be able to, I mean, you can as a board insist on what you want. You just need to pass a regulation that will go up to the state and they'll say, yeah, that's fine. You're being more restrictive because, for instance, if you were to look at your well results from a particular public supply well, and those nitrogen numbers were increasing over the years, you could say, we're going to be more protective than 4 bedrooms an acre. We're going to insist on the technologies meet a better standard. And we're going to say, instead of 4 bedrooms an acre, you get, 3 bedrooms an acre. You could do that if you find as a board, and you include that in your rationale for the regulation, that look, your nitrogen levels in that particular well are going up. You want to stem that tide, you want to have them decrease. So therefore, you're going to impose more stricter standards. Like I said, you can do more strict standards. You can't do less than Title V. So NSAs or nitrogen sensitive areas for marine environments, you definitely should be insisting on the best available nitrogen technologies. Has your town done the watershed management plan for those watersheds yet?
We have not, we're working on that currently.
Okay, so if a town has submitted a plan by a certain time, then of course you can go according to the plan. For instance, if the whole area is going to be sewered, you don't want to, and the sewering was within, say, 2 years they were going to do it, you wouldn't want to make people put IA systems in. But if that is part of your plan, the IA systems, for instance, in one of our watersheds, we have about 400 people who are going to have to put in IA systems. Then we will make them put in the IA systems. It's part of our approved plan. If a town decides not to submit a plan, as you know, the default thing is that every system in that watershed shall put in an IA system eventually. So that's why towns are in the process of putting together their watershed plans, which usually are a hybrid plan. They have certain amount of sewering, and then they say, we'll still need, say, 100. I know one watershed down Cape, 119 systems have to be IA systems that meet at least 12 milligrams per liter in that instance.
I guess one of my last questions, I guess, George, if you could just talk about the impact in terms of net benefit from if you have 40,000 square feet, a 4-bedroom conventional versus a 6-bedroom IA on that lot.
Well, the 4 bedrooms an acre, that will produce at the boundary an acceptable drinking water. That's based on what your rainfall is each year, which is diluted that water to dilute it over that an acre. That assumes a certain nitrogen load per person. And it does a calculation and says, okay, if you get that many bedrooms, assuming a certain occupancy, then you will have acceptable drinking water quality. So the 6 bedrooms an acre with an IA system says, okay, we can't meet that, so we're going to remove 50% of the nitrogen from the load. And that again would produce the same result at the boundary of the property. Now, a lot of that it's all theoretical modeling, but it's all we have to go by. So the benefit of having an IA system is sort of it's neutral. A 4 bedroom per acre without an IA system is equal according to the modeling, is equal to 6 bedrooms with 50% removal of the wastewater going out. So I can never really justify the modeling that they use for that, but it's the best we have. That's why it's never applied, by the way, in NSAs for marine environments, because what you want in a lot in a drinking water area, you want drinking water by the time it gets to the edge of the boundary, the edge of the lot. But with marine environments, if you had that concentration, 5 milligrams per liter or 10 milligrams per liter, entering into the marine environment, you would cause such an explosion of algae that you wouldn't believe it. Like I say, you'd be walking on water and not be divine.
Thanks.
Well, you've got quite a job ahead of you as a Board of Health. I mean, I'm sure you're going to hear many variances, many sad stories. Many you will believe, many you won't believe. It's not an easy position, but they pay you so well.
Do the more effective systems cost more?
Yes, a lot more. Uh, People generally choose the one that is the least capital cost, and those will be systems that are single tank systems, plug and play, and they'll do a job to get rid of 50% if they're operated properly. But the more expensive systems are usually more than one element. For instance, the Nitrex system is actually an Advantech system plus a box of wood chips. That's what it is, an upflow box of wood chips. So in our area, the capital cost, just that capital cost, is somewhere around 28,000. So you start thinking about the installation cost, and I don't know that there are any contractors here. I generally double the cost of that, the capital cost of the unit itself, because you're digging a hole, you're re-landscaping, things like that. So we've heard cost of $50,000 to $80,000 for systems here. Now, I've also seen some systems go in, these expensive systems go in for, say, $35,000. But generally, where they're being applied, they're in tough situations where they want the landscaping back, they want the wall replaced, things like that. So it gets expensive there. I would say that the cheapest system out there I've seen has been capital cost about $15,000. Um, and that's roughly half of the capital cost of one of these other systems. So it's definitely a stumbling block. I know that there's some legislative things going on where people can get credit for replacing failed systems, and they can get the credit. I think it's over 4 years. I think it's somebody in the room probably knows better than I. It used to be, just $6,000, but I think it's more than that now. On the Cape, we have low interest loans given through the septic loan program. The financing of this, I think, is something that is really tough for a town to grapple with because, I always say this, the only way I personally will ever benefit from a sewer is if I go to the the mall and I have to relieve myself because I'm gonna go back home. I'm gonna have to take care of my septic system and hope someday the DP or the town officials aren't gonna knock on my door and say, now you're gonna have to replace this with an IA system. Because as it presently stands, I'm going to have to bear all that cost plus the cost of my sewer that I'm paying on the general tax rate. So I think as towns engage and start using IA systems more broadly, they also have to have advocates for some sort of subsidies in the areas that really require them for the general citizen because they're paying for the sewer too. I mean, that's coming out of the general tax base, but they're paying every cent of what they're using to put their own septic system in. So there's sort of a social equity uh, issue on the table here. And in Falmouth, we're grappling with that now. What will the town do? You know, when they have this massive sewer plan that's going to cost hundreds of millions of dollars that will be on the taxpayer, but then the taxpayer that's not on it, will be a large part of our town, when they have to replace septic systems with IA systems, they're going to pay that tax too. So it's really difficult decisions that Board of Health has to make. They should be advocates for some general subsidies to people who have to do it, particularly people who are strapped in certain income levels, things like that. That's a soapbox. Sorry, I shouldn't have stood on that. I know I face it. We face it every evening. You know, every evening we meet when somebody comes in, they say, gee, we just want to do this. And the size system is going to cost us an arm and a leg. It's chilled off a lot of sort of the accessory apartment ADUs in our town. You know, they're allowed by right, but under the state legislation now, but in our town, we have regulations that, hey, if that's new construction, you're gonna have to do an IA.
Are there any other questions for George?
Hey, don't leave out composting toilets. You know, we're doing composting toilets and urine diversion in our town. We're looking at those as serious options. Composting toilets definitely around lakes and streams, lakes in particular, are probably your best option. You're never going to sewer. They take care of the phosphorus and the nitrogen, which is good. So I'll put a plug in for those as people start to want to develop. Uh, you know, that will, I think, one day be on the banner list. They're working on that now. The state is trying to consider how they use composting toilets in a wastewater management plan. But when you think of it, folks, really, I mean, how do we ever get to the point where we befoul nice clean water in a white porcelain bowl and then spend all that money to try to get it back out again? Why put it there in the first place? So I'm sorry, I stepped down off the soapbox.
Wonderful, thank you. We have learned so much, and we'll probably have more questions for you, but this is great.
Well, you got the email, so just send them along. I'm sure if you haven't got the email, you can get it. And the test center here, we just obtained some money from the Gates Foundation to look at some of the toilet technologies, not so much the IA technologies, but we do have some research going on here. Hopefully, we'll be able to roll out something that's a little bit cheaper than the proprietary ones, but who knows? I keep plugging and I'm 73 years in. Thank you
Wonderful.
very much for the
Thank you
opportunity.
very
Thank you,
much.
George.
Thank you,
It's a
George.
pleasant thing to see a Board of Health.
All right, great. Thank you very much, George.
Take it easy.
Well, that was very instructive. Lot to think about, lot to talk about. But we probably should go on to number 6, which is 259 Mattocket Road,
Yep, and I have,
septic loan request.
oh, sorry, that's that one. Yep, we reviewed this in the office, and there's no concerns. This is for a failed system in Mattocket, obviously. They indicate that this is their primary residence. We reviewed the quotes and everything that they got, and so there's no concerns. Recommend approval.
Okay, so this is, because the mailing address is different, is that because of the failed system and they have to?
I noticed that. I'm not sure what that means, to be
Yeah, I
honest.
mean,
It
'cause
did-
I guess it goes back to discussion we had several months ago about if it's primary, if you're a Nantucket resident, but it's not your primary residence, how much of the load are you entitled to? And I really don't remember if we came to an actual decision about it or just left it as a discussion of how to approach that. For your primary residence, 100%. If it's not your primary residence, I know we had talked, we talked about it. I don't know if we acted and changed the rules on that. And I couldn't tell from this application if that's primary residence or not.
I cannot, besides just,
John?
sure. Go ahead, Tamika.
So it is her primary residence. She is doing this on behalf of her mother who lives there, who is an elder in the home. So she put her mailing address so she can get all of the information and make sure that she does it because she's not always able to get to her mother's house. So it's for her. It's in a trust. The home is in a trust, and she's one of the people on the trust that can go and apply for this loan. So it's based for her mother who is now has just went into the hospital, and her sister has her still in the state of Massachusetts, but not at the home at the moment. But when she started this process, her mother was living at the home, and will be going back to the home once health issues come out of play.
Okay, now that clears it up. Thank you.
Okay.
Oh.
We need to vote on that or not? No.
Yeah, you need to
We do.
vote to approve, yep,
All right.
or disapprove, or.
Motion to approve.
Motion to approve the septic loan request.
Second.
Second.
All in favor?
Aye.
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 Done. Okay, number 7 is,
This one I have to recuse myself.
okay.
It's my neighbor.
Well, you don't need to move, do you? Okay.
Yeah.
All right, you moved. 24 Arkansas Avenue.
So this is just, I'll give a brief overview, but the designer is also online. This is just a local upgrade approval for property line setbacks for the new tank. I think everyone's aware of the townhouses out here and the constraints of the property lines and everything. So this is an upgrade. I'm not sure if it was failed, but I'll let Don talk to that.
Hi,
You're
can
good.
everyone hear me?
Yes.
All right. Can't get my camera on for some reason, but you don't need to see me. I was Don Bracken Engineering. I guess I'm the lucky one to come in with the first IA variance after that presentation, which I thought was great as well. Yeah, so the house had an inspection done for a sale. The soil absorption system passed the inspection. So the only requirement is for the replacement of the existing 1,500-gallon septic tank with an IA septic tank. In this case, we're using the microfast system. I don't know if you can see the plan, but you know, the lot's only 16 feet wide, and there's very little space for the tank to go in, and therefore we've requested variances to the neighbor's property lines, 2 feet to the east and 4 feet to the west, in order to upgrade the system obviously maximum feasible compliance and will be a great improvement over the system that's there currently. That's it. Thank you.
Yeah, sure.
Oh, I thought I was able to just drag before.
We won't present after the meeting. We'll be after that.
Oh, okay, I was just hoping for the members to see, but, did everyone see the plan, or do you need to see it?
Yeah, whoops. There we go.
Oh, boy. Zoom.
Oh.
Yeah.
Usually always works well. I always Yeah.
All right.
While you're doing this,
Another touch.
can I speak as a private citizen? Because I'm one of the abutters. So we support the plan. The townhouses in Nantucket, and like our septic tank is on her property. Her septic tank is on, you know, it's just how they did it to set things up. So as one of the abutters listed on in the package, we received a certified bail and we support, you know, that this is the best plan available.
Thank you.
And yes, so I should add, since it's the local upgrade approvals, the property owner is required to notify the abutters just so it can be at a meeting for abutters to speak at the meeting. That's really the requirement of this, this type of application. So if there's no abutter with any issues or anything, it's really an approved application.
Can I ask a question?
Yes.
Is the microfast system that you're using on the state list that we just learned about, and can get it down to the below?
11, but below
Yeah,
19.
below 19. I guess I just didn't see it on the list. And
I can answer that. It's not on the list. You know, one of there are very few systems on that list, and you know, we do a lot of work on the Cape as well, as you probably know, and the towns that are using the Banner system are mostly going with the Nitro Clean 2 system, in which we did put one in, if you recall, at 6 Washington Ave, over the winter, where we were asking for variances from, you know, from the Board of Health. And that was a case where we removed some composting toilets, and you allowed us to put the Nitro system in, along with monthly testing and to see exactly how it was going to perform as sort of a test case on the island. And the tests have been excellent so far, the results. So far, it's actually at about 3 parts per million. And so I would say, you know, just watching that last presentation, that I think for the board or for engineers, that's an option if you do end up going to that Banner type approval system. But in this particular case, you know, this is really the only system on the market that is going to fit in the confined space that we have. The microfast system, there are 361 of them already on the island. And it's either been that or the septic tech, as George has said. And, you know, most of them have been working. I think the average by the state is about 21 parts per million, but I think like 65% meet that 19 parts per million. So they do operate, they do meet the state standards. It's just they don't get it down to the 10 like the Nitro system does. But, you know, obviously, you know, that would be something that, you know, could be discussed in the future, I guess, for other applications.
And if I can comment, Madam Chair. So both the systems that Don just mentioned are both in provisional use, so they don't, so essentially they're in short, and still kind of in a final testing phase. And there are general use ones, but at this time, DEP still, if we were in this position, still allows us to approve a system like a microfast until those other ones get the general use approval. So it's at the discretion of the Board of Health to still allow those systems, which get down to 19 milligrams per liter. So,
Madam Chair. And John, if, per George's comments before, if they were to put in this system and it were to test drastically out of that, they would have to pull it out and put a new one in that did test positive.
That would be-
correctly.
yeah, if we tracked that and
exactly.
saw that it wasn't performing correct, yeah. And I would assume going down the line, for new construction and stuff, that's probably where we'll be going, so, with those other
Got it.
systems, so.
And all documents are in order for the health office here?
Yes, yep.
Okay. With that, I would make a motion to approve.
Second?
All in favor?
Aye.
Aye. Okay.
Thank you.
Number 8. Lot 5. I mean, Woodland Drive, Lot 5.
Good afternoon, Dan Malloy, Site Design Engineering for the applicants. So I think most of you are aware this, we've been in front of you with this application a couple of times already. On the same property, you've already approved the variance on 4 other lots. At the last meeting, are we doing lot 5 or 6?
The first one is 5.
There we go. So the plan for lot 5 is up on the board behind you. At the last meeting, the board asked that we come back with a plan showing the anticipated buildings. The previous plan, if you recall, had a building outline, just a building envelope we were looking to get approved. So they've gone back and come up with house plans as to what they intend to build. So what you're seeing now, the septic design on that plan is exactly the same as what you saw previously. The only change to the plan is the actual building footprints. So now you're seeing 2 separate buildings, a primary dwelling and a second dwelling. The request for the variance is the same. It's an 80,000 square foot lot that would normally get 8 bedrooms. With the IA system, with the bedroom credit variance we're looking for, we're bringing it to 12. And I'll go into the IA component as well, but one thing I wanted to touch on, I know 12 is a number that everybody's having a hard time wrapping their heads around. But to understand where 12 comes from, the way that bedrooms are counted, when the Board of Health is looking at a set of house plans, they're looking at what's in the house, not just necessarily a physical bedroom, but finished space. So a 4-bedroom house with a large finished basement could qualify as a 6-bedroom house, even though there's only 4 bedrooms in it, which is why we get to these numbers. We don't actually have a house with 12 designated bedrooms in it. But due to room counts, the way the house is built, it qualifies for 12 bedrooms. So I want to make sure that's clear. We don't have 12 bedrooms. The rules say we qualify for 12, but we don't physically have 12. So, and I know you've heard this multiple times, so I wanted to just touch that point. In terms of the treatment system we're talking about, we are using one of the banner systems. It's the Septitech unit that's proven. That was one of the systems you heard about earlier today. So it's a proven technology. It does meet the treatment requirement, and it's proven consistently, and it's in use. I don't know the number of units on the island, but I'd venture to guess into the hundreds. So that's the application. There's no other changes to the plan.
How many bedrooms are there?
Right now, based on the floor plans we're looking at, there's 8. We're looking at 2 4-bedroom houses, but with finished basements. And a finished basement, by definition, counts as 2 bedrooms. So we're triggered by a definition, regardless, even if we changed the design of the house and had 3 bedrooms, but certain sized finished spaces, just by room counts alone, we will get back to 12. we're playing with a game of a definition, which I'm sure John could corroborate. We have this discussion on applications all the time. We have a house, one room, somebody's calling it a den. It's a dining room. It's a finished space. It qualifies as a bedroom, even though it's not. Because of the characteristics of the way the house is designed, it qualifies. I've got other properties. We've done dozens of properties with 10, 12, 14, 16 quote-unquote bedrooms, which may only have 8. But based on room counts and room designations, they qualify for more, so the system has to be bigger. So that's how we're getting to 12. But I can't recall the last time I was actually in a house that had 12 actual physical designated bedrooms.
Any comments?
Is there pool or anything? I vaguely remember.
There's no pool proposed in this application.
Is this what the actual design is going to be, or this was just kind of put together so it looked better than like the last time? And I'm not trying to be rude, I'm asking because the last time it was just a square, and this is actually a shape, and so a lot of times what we see has like this is what we want to build, and this is why we want this septic, and that with this case, that has just never really been the.
So on the previous applications, you approved an envelope. For these two, you wanted more details, so they went back and sketched out what they want to build for houses. On this application and the next one in line, you'll see the same idea. So they have actually gone, it's not an HTC approved house, hasn't gone that far, but they are in process of doing those right now.
And will these houses have dry sewers the way that the rest of the road has?
They
know-
will not. There is a dry sewer line in the street. However, when that was constructed years ago, it wasn't constructed correctly. So it's physically there. It doesn't connect to anything and likely never will because the way it was built.
Oh, it says building sewer. That's why I'm on these.
Oh, the septic piping is often referred to as building sewer. That's all.
That was the dry sewer has been brought up when this has been brought to town meeting multiple times.
There is
So
a
that,
dry
and
sewer
that,
line.
that might happen, which it won't, but that was my question.
Jim, you're quiet.
I'm just watching this.
And this was town water, if I remember right.
It is town water.
Yeah,
yes.
okay, thank you.
Hi, my name is Darla Stuckey. I actually live on Woodland Drive. I'm just curious, I don't know if I'm allowed to ask questions, maybe through you. Is this the 2-acre lot at the end? I think you said 80,000 square feet. So is this the 2-acre lot? And is there an extra, is that space on the right the extra acre that doesn't have road frontage that you can't build on?
You're talking about the next application.
Oh, sorry. Okay. So this is not the 4 that are sort of on the left side? Okay. Thank you.
John, do you have comments on this? Does the health department have comments?
Well, I mean, I think at some point needs to be an incentive for people to put in IAs in this zone, in this area, until, the board decides on a regulation, which, if the board decides on a regulation to make it tighter or require different things than what the regulation is right now. So I do agree with Dan, in regard to, we hear 12 bedrooms. The board just voted on the new definitions a few meetings ago, which was an update to our local definition of a bedroom, which included things such as, we see floor plans where there's an office in the basement and there's a full bathroom in the office, which is now considered a bedroom. Full bathroom in an office seems a little strange with egress windows in a basement. But there's, as with Title V, there's a total room count of the entire, all the rooms in the house, and then you divide by 2. Locally, we're more stringent than that. And again, an office or a gym or a yoga room or, play studio, those all might end up counting as bedrooms just based on bedroom count and the number of rooms in the house. So, I rarely have I would agree. I don't know that I've seen 12 bedrooms on a lot where it was exact to the acreage on larger lots like this. Usually it's to have more amenities. For instance, the cabana buildings with next to pools and a studio building, if it has access to a half bath, we count that as a bedroom, even though, it may only be used as they're having dinner by the pool or something of that nature. So, again, I think there needs to be an incentive to have IAs installed. They are better systems, it's proven, better treatment. My suggestion, if any of these are approved, would be to have bedroom deed restrictions, and not just say a 12-bedroom deed restriction, but to say 12 bedrooms and bedroom as defined by the Nantucket Board of Health. That would be one of my recommendations if the board's leaning towards approval. I think as we're in this position now, and we had George and the moratorium and everything going on now, I think this is the time to really kind of think more about this stuff and see what direction the board wants to go and try and gather more information. And maybe that's something more to discuss at next month's meeting. But as things are now, I do think it's better to have an IA with these bedrooms than just a conventional system on this property.
I think that the other thing that we certainly heard George say on multiple occasions is if you're giving a variance, you're getting something back. And I think one of the things that he recommended that we get back is to require a certain level of performance. So could that be also written in with could we write that in with a deed restriction? I would think we could.
Yeah, or part of the motion as far as the, if it's approved, that they must submit yearly sample results for the performance of the system that's installed.
Can I ask, I guess through you, Ann?
Yeah, go.
To John, or Dan, is this lot on the edge of the wellhead? I know I brought that up and Mr. Morey said, oh, it's just on the edge of the wellhead protection. So I guess if it is going to be part of the wellhead protection, then an IA is good. But if it is actually not, if this portion of that giant lot is not in the wellhead, then the AI is really just for the extra bedrooms. Is that, I guess I just want to know that we're getting protection to our drinking water, because I don't think this whole 5 acres is in the wellhead protection. I think that the Lover's Lane one was, but this one is on the edge of the water recharge.
I know it's on the edge. I don't know if Dan can, I believe they are inside of
I
it.
can't recall what the line is, and if you could call
the
it the
exist-
GIS, we can look. But I
An
can't
existing
recall
well
exactly.
protection zone is this arc starting right there.
Right there.
Yeah, and that arc that goes around touches like the edge of the second structure.
Oh, that's
That's a well.
that's a well,
That's a
sorry.
private drinking well, so we're not
Okay.
showing a limit of the well district. I
Okay.
don't,
That's,
we could call up the GIS quick and answer that question, but I can answer partially. the way the rules are applied, if the septic system itself was not in the wellhead protection district, I wouldn't be here. By definition, I'm here because I'm in the wellhead protection district. But I don't know where that line, I just can't remember where that line lands relative to the property. But we wouldn't be here if that weren't the case. And in terms of the treatment levels you mentioned, the Septitech system we're using is in the top tier list. It is consistently below the 19 milligrams per liter. And like all the other systems on the island, they are tested, and if they're not routinely hitting their numbers, John's gonna know about it, and then we're gonna know about it, and then we have to fix it. Whether, you can clearly put that in the restriction, part of the approval, but we have to do that regardless.
Mr. Mulley, how often are those tested?
They're annually. I don't recall if they're semi-annual for those,
So-
but John would know better.
Sorry, so, Madam Chair, so the first year is actually 4 tests are required, and then after that, it's every 2. It's 2 samples a year after that, so, by our regulation, our septic tracking, so.
John, you mentioned before about something like requiring yearly testing. Do we do that for anybody else? Would that be onerous on the home?
It's a requirement anyways. It's
Okay.
a requirement of Title V. It's a operation and maintenance agreement is what it is, with a service provider that takes the samples, and also maintains the system,
Got it.
so.
It's all part of the maintenance contract they have to have with the system.
But, again, I'm going to kind of ask, within that, is there a explicit understanding that if it's not performing, it can be forced, it can be made to be taken out? Or is it just a matter we have data that shows it's performing or not performing? As part of it is like we're sitting on it, is it real data that leads to something, or is it just numbers that we just kind of say, well, that one works, that one doesn't? I mean, where's the teeth behind the?
I would think we could have something in here that would say that if it did not meet the requirements, that there were corrective measures would be taken. Whether that means pulling it out or fixing it or doing whatever, it has to be corrected.
I think what you heard in the presentation at the beginning is the regulations speak to that now. You can certainly comment on it, or I should say copy it or explicitly mention it in documents, but it is specifically part of the regulations now. If you have an IA system that is not functioning and you cannot make it function as it's intended to function, you are required to correct the situation, whether it's fixing it or replacing it. It's a requirement, period. And you can certainly add that in other forms of language, but it is a requirement right now.
Have we ever done that?
Sent out those letters.
That's saying that, it's unperforming and it's gotta.
We have, it's certainly another big thing of tracking. Luckily, Barnstable County initially sends out letters when they notice that the operation and maintenance agreements have expired. They haven't re-signed a new contract with the service provider. So Barnstable County initiates that part of it, and then after 2 attempts, they'll notify our office, and usually, we'll follow up with some type of enforcement on that. We did used to have all those results emailed to us quarterly, I believe. We haven't been receiving those. I know Barnstable County changed their database a few years ago, and exporting things onto Excel sheets for whatever reason became a challenge.
Well, I would have to say that if we are going to continue to grant variances, understanding that these systems are better and understanding that when you do this, you get something back. I also think that we have to really sort of zero in on this. We have to know what's happening. We have to understand what's happening. We have to watch it, and we have to act on it. So I would like to have language inserted into this variance that would require that.
And John, correct me if I'm wrong here.
Yep.
The current IA system requires that at the 19 milligrams per liter. If we were going to go over that, you would be stipulating a nitrogen level below the 19.
Right.
I have the map right here. It looks like the other ones that we approved actually are in the recharge, but the ones, this one and the other one are sort of on the edge. I mean, I can't get past 12 bedrooms. And I understand that that's not all, this does not look like a home that I concerned about these systems not working that well when they're only being used for 6 months a year and not being kept on. I mean, I just think there's a lot of concerns in my mind on this.
Would it help you to have it stated in a different way than 12 bedrooms? Would it help you to state, because it does in my mind, to say, what is it, 6 bedrooms, 8 bedrooms, whatever it is, with a finished basement? Is that, and it's actually the one house is 6 bedrooms with a finished basement, is that right?
Well, before you go to, I understand where you're trying to go. but
Yeah.
To go in that direction, now we're also asking for variances from the definitions themselves.
Yeah.
All right, okay.
It's gonna get a little more difficult how we go about doing that. We can go down that path. I'm not sure it's a good path to go down, because it's gonna get a lot more complex by bringing the other definitions into play.
Is this lot going to stay one lot, or is the plan to subdivide? Just, I know that we have had issues with homes owned by separate people sharing septics before.
Well, as it stands right now, it's not subdividable, so zoning doesn't allow it. That's the only answer I can give you.
That's fine.
We would have no issue with the 12-bedroom restriction. We have no issue with the testing requirement, meeting the 19 milligrams per liter requirement. Those are all things that if you were to grant the variance, whether you added that language or not, they are part of the variance and part of the regulations. So adding it is perfectly fine. We're not, have no issue with it. You would just, by adding it, you're just making it more front and center, so somebody's very much aware of it.
Yeah, I mean, I think if we were to add, I mean, that's kind of, I think, where we're going is we want.
That's the point. Is
It
to,
really is that, there's agreement, like there's an agreement and this is really it and we all understand it type thing. So it's just like you said, make it front and center.
right.
Sorry, I mean, putting a restriction of 12 bedrooms is like, here are all of the bedrooms that you could possibly have, but you can't have any more, but you really legally can't have any more anyway. Like, it doesn't do anything. I guess I would feel more comfortable even if it was down to 10 bedrooms or the 8 that they knew they had when they bought the property and went into this, this is what you can have. And I mean, I have a lot of issues with this whole property because it was a junkyard, and I don't know if any of you walked by it, but I walked by it a lot because I live down the street and not in a butter more than 300 feet. I don't know, at least a half a mile. But I think there's just so many my concerns of having a lot of people living there with soil that is likely contaminated. I mean, there were cars and an RV and like all of this that I just really feel like this land has already been contaminated, and I know it's been cleaned up and the soil samples but there's already been a lot of damage that now we're gonna say, yes, let's have 12 bedrooms, just 24 people. That's a lot.
I'm not trying to argue, but the property wasn't contaminated. It was never dirty. When we hear the word it was clean means the cars and the junk was taken away. So people were out there, the fire department was out there. And I just don't want people to think it's a contaminated site or was. This piece of property had junk cars on it, but functionally it's no different than any other property in the whole neighborhood. So just to be clear on that.
You just have to go to a
Go to
microphone.
the mo-
Well, I walked it too, and there was an oil drum, and there was oil leaking out at one point. So I don't know what contamination is. I guess Board of Health tests the soil, but it certainly looked contaminated to me, just for the record.
Madam Chair,
Yes,
I don't mean to disagree or be disagreeable, but that is kind of speculation. And I think what's before us, whether that's true or not, what's before us is either it's going to be a conventional or it's going to be an IA system. And the contamination is going to be objectively worse with a conventional system. So I think we should talk about further policy and as per our previous discussions, but as John said before, the IA system is clearly the better route. And I'm not sure what we exactly put in the motion, but it seems like the only reasonable outcome for this property to be mindful of what our purview is.
I think that, how many bedrooms how many rooms? I think that what we're hung up on is the word bedroom. How many rooms was this property before it applied for the variance? The big house.
So when we applied for the variance, the initial plan you saw just had a building envelope on it. It was just a box showing a proposed house. There were no,
And
Design.
without the variance, how many bedrooms would that box house have gotten?
without a variance, the property is allowed by right to do 8. Just
Eight.
with a conventional septic system, they can do 8.
Between the two.
The entire lot, regardless of the number of buildings, 8 bedrooms.
Okay.
Conventionally, without the IA system.
Okay. So we're giving the property, by putting in the IA system, we're giving the property 4 more rooms, whatever we want to call them, living rooms, bedrooms, something rooms. And I think that, I have to say that I believe that this is we're going to have to come to terms with what we're doing with this going forward, and we're going to have to, this is one of the other things that we're going to have to lay out time at a meeting to really sort of wrestle this into the ground. But I don't think we can do this now. This is, we have to make a decision on this application, I believe. So I guess, is there a motion to allow for the 12 bedrooms with the 2 stipulations? One is the deed restriction, and the other is the requiring a level of performance below 19 milligrams per milliliter.
Can I just ask one quick question? In the basements, are there going to be kitchens by
There
design?
wouldn't be
I mean,
kitchens.
because
I
that's,
don't believe they're looking at kitchens, but there'll be bathrooms down there. If they put a gym down there with a bathroom or finished, they will be counted as bedrooms regardless.
right, I guess I'm just thinking about, do they get turned into multifamily
There's-
housing?
There's no intention for multifamily. I don't believe it's allowed here either.
Yeah, it was allowed and not allowed to, that was our earlier discussion about, our concern about long, year-round rentals. Okay, thank you.
I think if you're going to say below 19, you have to be a little more specific.
If I could interject there, the approval for the septic tech unit we're asking to use, that we normally use for these type of areas, specifies its qualification by its definition is 19, it has to meet the 19 milligrams per liter requirement. That's how it's in the list in the first place. So thinking maybe you're implying is the system has to meet its approved criteria of treating at or better than 19 milligrams per liter
With regular testing.
with regular testing as required. That's routinely done, and I don't think anybody on our end would argue either the conditions or if the system's not working, they either have to make it work or replace it. That clearly, it's just not an option for us, but it has to be, and that's what the regulations say.
Madam Chair. John, let
Yeah.
me clarify. So on the graphs that were in George's presentation, there's a distribution, right? And then there's the line for, say,
Yeah.
19, right? Some of them, there's a couple of them which are the outliers that are above, and then there's the baseline, and there's a bunch of them below. And so I think that, this is very new to me, but I think what that's saying is that based on the conditions on the ground, there are some systems that it performs at a baseline level, and there are some systems or some exact examples that work, most work a lot better, and there are some that for whatever conditions that don't. But you still have to meet the minimum regulations. So whether the system that you're thinking of, that your client's thinking of putting in will perform at the minimum level, but once we require, say, 13 or something, that's a little, like we need to come up with a policy for everything instead of piecemealing it out, because the system based on that data, it looks like it's going to perform below the 19, but it seems like we shouldn't say, and correct me if anybody disagrees, we shouldn't say, oh, well, now it's 10 for you, and then we'll come back and 19's the baseline, and this next property is X.
Right, what I would, and I'm not trying to get a benefit for the owner, but what I would recommend is you say they have to meet the 19. And as you further this discussion for other going forward, during the moratorium, figuring out what you want to do with this, is then you start looking at regulations and do we want to incorporate a number in certain areas? And I think, I could talk about that for a while here now as well. I don't think it's the time, but I think you could do that, but you're going to have a lot of discussion to get there before you start going consistently lower than 19, because it is still an evolving technology. It's not quite all there yet. You can say across the board, we're going to do this. But in time, you could.
But did you not tell us that your company, the one you're using, is one of those ones that's,
Septitech is one of the units, it's one of the systems that's consistently below the 19.
right?
Right, but I think in the future, if you're going to start leaning towards something less than that, that needs to be a much further future.
I agree, but I think if we use the word below 19, that covers it.
It does.
Or 19 or below.
So we're not letting you get away with 19. It's got to be below 19 is what I would say.
And
But
that's
we're
fine.
not saying a specific number.
It's what he just said. If you look at the graph, there's a very substantial number of systems that are consistently well below 19.
Right, okay.
Yeah, I mean, this is Septitech, and that's a 19 line, and all of these are, so it has what 85% performance at below 19, and about, this is the one where George commented that it's probably about 50%, 45 or 50% that would be below 10. So it has a range of performance, but 85% from the numbers they have, which is 82 samples, are performing at 19 or substantially below 19. So,
Well, I mean, I think as long as we say below 19. So are we ready to move on this, do you think? Karen,
well,
you wanna make-
I guess,
Tom, you want to make
yeah.
a motion?
Well, let me just ask, the deed restrictions that have been talked about, I don't, again, this is new to me. Are they included in this pack?
So the deed restriction is a boilerplate. The state DEP has a boilerplate deed restriction language that is often used. The board has used it probably 100 times. And it's a boilerplate form with just the generic information whatever number the restriction's gonna be is plugged in, and it's recorded. That's it.
Under no
And it
circumstances
gets
can you go
transferred.
any higher than
Yeah,
that.
and it
Got
gets
it.
transferred if the house gets sold. I mean,
Yeah.
that's part of the
Right.
deed.
You can-
that-
Nobody can come back and say, oh, actually, now we want 14.
Okay, so I'm gonna, John?
Oh, I'm sorry, yeah, they can't go above 12.
Yeah.
No matter, yeah, anyways.
Okay, I'll jump off the ledge here. I will try and make a motion here, and I will accept friendly amendments. I would make a motion to approve based on the deed restrictions that are standard form and a performance standard of below 19 milligram,
Milliliters.
Milligrams per milliliter.
thank you. That, and that there is a annual review that is submitted to the health department.
Sure.
Any friendly amendments?
I think, don't they have to be tested 4 times in the first year?
But
Yes,
again,
that's
that's.
correct.
Yeah, and again, that's all part of the requirements.
Right.
I think the required testing would have to happen regardless, and maybe an annual review would be a summary of whatever testing has
Yeah.
transpired. Is that maybe?
So could you say that it has to be done quarterly, because then it will have to be on all year round? So if this is not a year-round house, which I have my doubts about, then it would have to be tested like for the first year quarterly, unless you guys, is that how it happens, that it gets done quarterly?
Once everything is built and active and functioning, it has to be done quarterly for the first year, and then it's twice a year after that.
I don't have an amendment.
Motion's clear as mud?
Is there a second?
Given that we have to deal with this, we have a moratorium to start addressing it, but this has been in the system, and they're using a system that is performing pretty good. I'll second it with the amendments that have been stated.
All in favor?
Aye.
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 No.
No.
Okay, it passes barely. I think what we've learned from this and is that we have got to address this whole subject. And I don't know if next month is the time to do it, John, because it looks like we've got to have a big discussion on the short-term rental situation, but certainly, if not August and September,
Right, yeah.
can we?
Through you, can I make a suggestion then that maybe we have a second meeting in August? Because the moratorium ends in September, so we're basically did a moratorium for no reason if we don't do anything before September. So if,
All right,
I mean,
think that's a
that
good idea.
seems,
I think that's a fine idea. I think we might need to find, yeah,
Yeah, if the board wants to make a motion to do that, I'm just gonna have to try and find availability on a room. That's the only thing, but that shouldn't be a problem, whether it's this room or the
or
trailer.
the trailer, yeah, okay. Can we
Do
Can
you-
we
do you-
move on
yeah.
this? I
Do you
think
need, do you need a motion from us to go ahead and do that, or just us saying we want to have a second meeting enough?
no, apparently we need them,
I think we probably need,
I imagine we do.
Formalize
This is official to get a second meeting on. Is that right, John? I think so.
I think the board could make a motion to just say to have a meeting planned in August.
Supplemental
Yeah,
meeting
a
in
second
August.
meeting in
Yeah.
so I'll make a motion to
At a
have
date
a
to be
supplemental
determined.
meeting to be determined in August to discuss the variances and all of the septic
and I,
information.
and I second it.
Yeah, all in favor?
Aye.
On that?
Aye.
Aye, yeah. Okay, so John will be looking to you to find us a second
Okay,
date.
a second. I love seconds. And then there's another
Yeah, we have
number
about 6
9
now.
on the agenda.
Okay, we have number 9, which is Lot 6 on Woodland Drive.
Okay, Dan Malloy, Site Design Engineering again. I will make this extremely short. This application is identical to the one you just approved. The only difference being the variance request is for 7 bedrooms. Other than that, the request, the design, the treatment technology, the septic tech, everything is exactly the same materially as to what you just approved. I can go into more if you'd like, but everything is generally, everything I'm going to say is exactly what I just said in the last application.
Is that all one house?
That is, there's one house, there's 2 houses, there's
Two
one in the
houses.
front, one in the back.
So how many extra bedrooms are you asking for with this?
This goes from 4 to 7.
So I just want to remind everyone that we already approved 12 bedrooms on
Yeah.
one end of this lot. Now we just, again, I don't know how many of you drive in this neighborhood, but it is not densely built up. All of the lots are very large, and there's like one house on every lot. So we're allowing the IA system to dictate a very much more potential density in a neighborhood that is not dense. And I know that's not necessarily what we're talking about, but I do think it is important to remember that is, so now we're up to 24 bedrooms, and we're going to add another 7 bedrooms in an area that literally Woodland Drive is essentially a cul-de-sac, and there's houses along one side, and not one of those lots has more than one house on it, I don't think. And Skyline Drive is very similar, pretty much, I would say with a few exceptions, all of those lots have about one house on them. So this is my issue with the IA variances, is that we're getting into this territory where we're allowing extreme buildup in areas that maybe can't handle it nor should handle it.
I would agree with you, Meredith, and it bothers me terribly, but I think we have to understand who we are. We are the health department. We are not the planning board. We are not the zoning board. We are not all of those kinds of things. I think that is sort of their thing. And I don't think we can go saying, well, we just don't want density in this area, because I don't think I would love to say that, but I don't think it's our purview.
Well, it is a little bit because it's the wellhead protection zone. But
Anyway,
it has,
we have to today, we have to deal with what's in front of us, I think. So, do we have a motion on this one? Anybody have any extra questions or different questions? It's obviously the same company. Yeah. Hi. Sure.
I just have more questions. Again, I know the history of this from being at town meeting for the last 2 times, but my understanding was this is a 1-acre lot, and it didn't have frontage, so it couldn't be built on. We had meetings where, the neighborhood talked about giving them an extra building lot of 1 acre, and Stephen didn't want it. So I'm trying to reconcile what I heard in the past with what's going on now. So my question is, how many square feet is this lot?
So that lot's
Sorry,
40
47,000
47,000
square
square
feet.
feet, and the owner is working on zoning issues related to what you're asking about.
Say it again.
The property owner is working on the zoning issues you're talking about in terms of access and frontage. So this lot, we're in front of this board for the septic approval. If it is actually going to be built upon, he may have to get other relief elsewhere to complete it.
So, okay, that's fair, but I do wonder if he gets approval from septic and then he goes to the other boards and says, well, Board of Health gave it to me. So there's a little bit of that goes on, I think. So just think about that, because this was an unbuildable lot because of the road frontage. And originally, he said he was going to make a park out of it, so. Again, it's just.
Yeah, well, I know that last month, I mean, I think that was a question we had, is that when these plans are done, and that's why we said we want to see something on paper that says something, because it's like we seem to be first now, and we don't, there's no other plan that's in place. And I think maybe that was one of the things we had to discuss with our, what is the process for building something new, and what are the steps, and really who goes first, who goes second, who goes third? Because we've found ourselves having to correct or being pushed like, well, they approved this and it's totally wrong, but you guys got to do something about it. And to kind of stop that that things kind of get passed along, and then a group ends up with it. A lot of times it's us, because a lot of times I think we're last in the line. So, it was one of the reasons why we pushed back last month, was there's obviously a lot that's not known about the plans for these lots. And we're kind of approving based on, what you're presenting, and you have no reason to think you're not presenting anything honest. It's just that there might be more going on, and the other departments haven't necessarily touched these yet.
Yeah.
And what is their role, and what does that do in terms of, are they going to use our approval to push through other approvals that require variances? So, and I know, again, that was a topic that we talked about last month, and that was kind of why we pushed this back to this month. So,
And I can tend to answer that in a general manner. So there is no prescribed sequence of events.
Yeah.
Every property is different depending on what its issues are. So what's the largest issue we have to understand before we can go to the next step. And the last few, unfortunately, yes, it was you. It was this board. We couldn't proceed on our next phase until we knew what our limitation was, and our greatest limitation was, what can we actually build? So on those other properties where now they have a bedroom count, they know the septic capacity, now they can finish the designs of those houses. The same thing here would happen. This lot in particular, if it's to be built on, it needs a septic system approval first. It may need other approvals from other boards. And I would say recently, from my experience, a lot of other boards, just because we have your approval or somebody else's approval, I would say generally that that's nice, good for you. We don't care. That, not in that exact wording, but taking that approach, well, they approved it, you would have to prove it now. I'm not sure that historically it may have worked, but I would say in today's world, that's not a very common theme. Probably wouldn't recommend approaching in that way. So this does have other needs to it, absolutely does. But we need to get through this before we can proceed with everything else.
Well, how do you decide who goes first? This is what Carrie said a minute ago. Do you have a zoning ruling first?
So-
And then you say, all right, this is what is allowed zoning wise. Now, let's see what we can do in terms of our,
So that comes down to what
Sure.
you were saying earlier, is the only thing this specific board can address on this property is septic systems. And I'm just not trying to be blunt about it, but that's what the application is. So this board would rule on the septic system, planning board or board of appeals, or if there was a wetland issue, the conservation commission, those boards would rule on those issues. So we're before you just for the septic issue. It will need, if they're going to build in this lot, they will need other relief from other boards. But there is no regulation stating who goes first. So the rules don't say we have to go to them first or you first. We get to pick based on our interpretation of the need, which rises to the top before we go down the list.
But I would, maybe you ask the town lawyer this, but if he's asking you to make a determination on septic on a lot that isn't even legal yet, why are you wasting your time with that? He can come back. I mean, I don't know if that's.
Yeah.
This lot has no, she's right, it has no, it's completely surrounded. There's no road, there would have to be a road built and approved, so I make a motion to deny until there is something, there's no way for that to be a house because there's no access anywhere.
And if I could just add that that's not in the purview of the board. That's not, the only ability this board has in terms of this application is the septic system. That was said in the previous hearing for other issues. We're here for a request to do the septic system, and that's it. Whether there's one house, two houses, three houses, the size of the lot, everything else is not in front of the board. It's only the question of the capacity of the septic system, the variance.
So if it's not a real buildable lot though, because it doesn't have any frontage, then John, do you have any words of wisdom on this?
Madam, I was going to ask a question, Madam Chair, is if the lot is recorded with the registry?
Is it recorded yet?
Right, that's my
Is
question.
it recorded?
I don't know, I'm asking that question.
I don't know the answer to that. Last
I
time
mean, if
checked.
it's not a recorded lot, what are we talking about?
I would say we have to defer on this one. I think it is too complicated. I think, I mean, everybody has made wonderful points. They're all important. This is gonna have to come up. We probably do need legal opinion on this in a situation like this, when we don't even know if a property can be built on. Should we give our opinion on the size of the septic system and all of that? I just, it's gone too far for me.
I don't think we should be discussing it. It's not even a lot. It's not a registered lot, so what are we talking about?
Well, we don't really know what it is the point right now. So I would say we defer and we actually have consult with counsel in terms of how we proceed on these, because there seem to be quite a lot of these sorts of things.
So our option would be to deny, I guess, continuance again. I mean, I
Well,
guess that is,
If there's question in this area, I'd ask, based on what I'm hearing, I'd ask for continuance to the next available meeting. Be that in August, I assume, so we can try to bring more information to clarify if that's what the board's looking for.
because I know that you're saying our scope is limited, but it's hard to look at something and see that there's other problems.
understand the
Yeah,
confusion.
so,
I really do.
and we understand but, I'm not sure if your interpretation of what we can say or do is too limiting too. And I think that's kind of what we're, you look at something and go, that's not right. This is our part of it, but there's a bigger picture that we're just kind of struggling with. And,
And I would, based on this, I would ask for a continuance to the next meeting.
That's what-
So we can
yes.
answer some more questions for the board.
I would recommend that. Tom?
Madam Chair, I think a denial would be arbitrary based on our previous
Continuance
conversation.
is a good
So
idea.
I'll make a motion to continue it to our, August
August?
regular scheduled meeting?
Yes.
Yeah.
Second.
All in favor?
Aye.
Aye.
Has it been seconded?
Aye.
Yeah.
Oh, okay, I
Yeah,
missed,
yeah.
I'm sorry. Aye.
Jim did.
Yeah, okay. Aye.
Okay, good. Okay, thanks.
We have Andrew's update.
Oh, Andrew.
Andrew, I have to stop sharing my screen. Andrew, hold on.
Yeah, John, I just sent a request to share my screen.
I'm sorry, can you speak up, Andrew?
Oh, can we
I
get
just
rid
sent a
of this guy?
request to share my screen.
Okay,
Oh,
yep.
Yeah.
I was told that I need to stop sharing mine. Oh, gosh. I'll allow you, but I'm gonna try and figure out.
No, read it all.
Stop sharing. Okay, I allowed yours, Andrew, I'm not sure. We're not seeing it, though.
All right, how about now?
Yes,
That's up.
that's it.
Okay, great. Good evening, everyone. For those who don't know, I'm Andrew Shapiro, the Environmental Contamination Administrator. I will be giving a PFAS update to the board this evening. Brief agenda, I'll go through my monthly data update and give some quick updates on a few contracts we have going on. So first, the data update. If you all remember, at the May Board of Health meeting, I gave an update on an imminent hazard detection that was detected near the intersection of Hummock Pond and Burnt Swamp Lane. Mass DEP was out on the island at the beginning of June, excuse me, and we helped drive them around to collect 11 samples. This turned up 2 more imminent hazard detections. Again, very serious concentrations detected in water. One was 171 parts per trillion on Oak Hollow Lane. This is greater than the concentration that was detected back in April. That concentration had been 124 parts per trillion for the Massachusetts PFAS 6. In addition, Mass DEP detected 87 parts per trillion on Hummock Pond Road. This is technically just under the imminent hazard threshold of 90 parts per trillion, but it's very close to that threshold. So Mass DEP is treating this as an imminent hazard detection. We also got an exceedance of the Massachusetts state standard, just barely at 20.1 parts per trillion, and we had 8 detects below the Massachusetts state standard. There were no non-detects in this area. We do see an interesting pattern, though. The 2 new imminent hazard detections were in the immediate vicinity of the April imminent hazard detection, and we have quite a variety of concentrations detected here. Just a couple 100 feet away, we have a detect as low as 2 parts per trillion. You definitely don't want to see 2 parts per trillion in your well, but it's quite a different situation from something like 171. And so we are seeing similar patterns on the island where we have very high concentrations close to relatively low concentrations, which really speaks to the importance of testing for more wells, because we have places on the island that have non-detects or low concentrations. That doesn't mean there can't be a high concentration somewhere near there. And I'll get to more data to kind of walk through that. On top of the DEP data, we're getting a lot of data through our voluntary program and through testing for our Board of Health property transfer regulations. Since the May meeting, we have had 66 samples come through. We got 2 detections above the maximum contaminant level of 20, one on Thurston's Way and another on Bassett Road. We got 46 non-detects, and we got 18 detects below the maximum contaminant level of 20 parts per trillion. So what is the town doing about these latest detections, both above the imminent hazard level, above the state standard, and even above the non-detect level? Well, for the imminent hazard level, we spoke with Mass DEP again. This is a Mass DEP investigation, but as the town, we want to support them any way we can, and we want people to be aware of these hazardous conditions detected in the groundwater. So we sent 3 notification letters out to abutters who are newly within 500 feet of the imminent hazard conditions. As a reminder from a couple months ago, Mass DEP's policy is that they do send out letters to abutters within 500 feet, but we want people to be aware of contamination, and we want them to be able to leverage the testing that Mass DEP provides. So we send out an additional letter just to make people aware. For detections over 20 nanograms per liter, outside of the DEP investigation, we forwarded that information to Mass DEP for their ongoing island-wide investigation. I also let the water director know about all of the detects over the state standard. And for all samples, regardless of the concentration value, I reached out to offer assistance to each well owner. So Mass DEP has detected concerning levels in the Hummock Pond Burnt Swamp area. So on July 2nd, they were out on the island to resample. I believe it was the two recent imminent hazard detections. That's their policy. When they get an imminent hazard detection, they resample. And they also sampled at one additional home in the immediate area. Mass DEP is planning on doing more sampling. They have reached out to us for some assistance in identifying nearby properties on private wells. They will be on the island next week for more sampling. I don't have an exact list of addresses where they're planning on sampling. I do get the impression that it is perhaps outside of that 500-foot radius. That's good news. We want Mass DEP to be sampling as much as possible when they are out on the island. And so putting this all together, I'm continuing to update this map. Just as a reminder for anyone who hasn't been at previous Board of Health meetings, these green buffers show people who live within half a mile of detections over the state standard of 20 parts per trillion. The purple buffers show people who live within half a mile of a detection over the imminent hazard level. With the exception of buffer number 7, the extent of the contamination is pretty similar, and that's because the recent imminent hazard detections were so close to the previously known imminent hazard detection. I'm continuing to update the numbers on each of these buffer counts. You do admittedly have to zoom in a little bit for those numbers, but those show the strength of our knowledge about PFAS contamination in these areas. It shows that there is some variability within these areas, and just how many detections over the state standard that we have. The new buffer on this map, though, is buffer number 7. So this is based on a recent detection on Bassett Road off of Pulpus. And this, frankly, was not a place we expected to see PFAS contamination. So it really speaks to the importance of getting your well tested. Mass DEP recommends that everyone get a well test every 10 years. And so I would highly recommend that anyone listening do that. We should by no means consider the extent of PFAS contamination on the island to be delineated. We should expect that we're going to get more detects, unfortunately. And so we really need to be getting the word out. We did let the INCI and the current know about the recent imminent hazard detections, so we're hoping that that gets the message out that there is both concerning levels of PFAS near the recent imminent hazard detections, as well as throughout the island. Just some quick summary statistics. Mass DEP, as part of their source investigation, has now sampled at over 100 properties on the island. And for our voluntary and Board of Health regulation data, we're approaching 200 properties sampled. We're continuously getting data. I can say that we've exceeded 200 since the time that I submitted this for the packet. And of course, we're still getting detects throughout the island. Just another way to look at the data. This might be helpful for some people, showing the distribution of the data. Last thing, couple quick updates. I've been including as placeholders 2 bullet points on contracts with TRC, which is an environmental consulting firm. One is related to PFAS fingerprinting. One is related to data management. I don't have any substantial updates on these, but I'm keeping them just as a reminder to provide an update when we do have something to share. Last update for me, Eastern Research Group was on the island at the beginning of last week, and they sampled surface water throughout the island. They sampled at all public bathing beaches, as well as a few additional locations. We are hoping that we'll be able to share that data at the next Board of Health meeting. That will be the originally planned Board of Health meeting, not the supplemental one. That's also assuming that we have the data received from the laboratory. We think that that will be possible, but no guarantees. As you all know, it does take a little bit of time for laboratories to turn around PFAS data. With that, that's the end of my presentation. I'm happy to take any questions, though.
Thank you so much. I just think that this is a little scary how much bigger it is getting, but I don't see, like, is Sconset all town water?
There's a lot of town
and
water in Wisconsin.
Tom Nevers? Like, I don't,
Tom Nevers is private wells. Yeah.
so there's been no, either there's, I mean, maybe they've been tested and they're fine, but there's no circles there, and I just would be interested, I would hate for places to be left out that, because it sounds like I mean, looking at this, it looks like we don't really have a handle on the plume at all, or multiple plumes. I mean, this is a huge health hazard and concern for our community. So I don't know how to get some other testing done there, but.
Yeah.
Sorry, go ahead, Andrew.
I can say that we do have some testing there. We haven't had anything that has exceeded that state standard. I will absolutely be continuing to update this map. I hope we don't get anything in that area. It is certainly possible, though. But yeah, you're right. There is PFAS throughout the island, and the source of much of that is unknown, unfortunately, which is scary.
Hi, Andrew. Carrie. So I guess one of the things, and I'm not sure if this is a task worth doing, but we know what real estate transfers have occurred this year. If we correlated to see that we have the same number of tests from real estate transfers as real estate transfers. Because I can't imagine that homes haven't been sold in Tom Nevers and stuff. So that was first just kind of more of a statement. Do we know the depth of private wells? I mean, is that something that we know or a homeowner might know? I mean, I know that we had our wellhead replaced a couple of years ago and it's in the ground. Yeah. So I don't know if that's a figure that a homeowner or is recorded somewhere. Because I mean, is that a variable that may play into what kind of readings people are getting if PFAS is more of a surface, attracted toward the surface versus deeper?
Yeah, I mean, we have some scattered well depth data. Mass DEP has their well viewer. I think we often find that data is imperfect or incomplete. To some extent, I do think that well depth matters quite a bit. That might be one explanation of why we are seeing such different results over small areas. It has something to do with what's going on underground, whether that's groundwater flows or it's well depth kind of remains to be seen. But I think you are right that is a factor.
And one more quick thing, and yeah, we talked about the surface waters. Are we doing any testing of the ponds for surface water and PFAS? I mean, we got the beaches and stuff like that, but since we do have a lot happening in some of the ponds with the harmful algae blooms and stuff, I mean, is this like another piece of data that we should be assessing, just from the ponds themselves?
Yeah, it's something we might look into. So to give you a few more details, we tested at all public bathing beaches. What we're really concerned about is the potential for incidental ingestion of potentially contaminated water. So some of those are inland ponds, such as Sasachica Pond. We also sampled at, John, remind me, was it the top of Hummock Pond?
Yes, that's correct. Yep.
We sampled at the top of Hummock Pond, which is a place where we have seen harmful algal blooms. We are going to be doing another testing in August we have the flexibility to test at additional or different locations, depending on what we find in this first round of sampling. Now, your question about exposures through contaminated ponds, one of my main concerns would be contaminated fish in those areas, and that's something we are thinking about as well. So that's one thing I have on my list of community exposures to assess. I think it's an important pathway, to be honest.
Can I ask one more question?
Yeah.
So you're here for a week a month, right?
In the off season, correct.
Because all of the well depth information is in the planning department. I went there myself to find out about my own well, which was, I know, not going to be shocking, was very shallow, which is why I had PFAS in it. But I think it would be really interesting to know some of these imminent hazard ones, how deep. Like, is their well 100 feet deep or is it 30 feet deep? Because if it's 100 feet deep or 80 feet deep, that's, I would say, an even bigger red flag for us and the neighboring wells, because I don't think, at least when my well was dug, that they were going very deep. And I think that, someday if we ever look at the well stuff again, there may need to be a requirement to go a certain depth down to avoid this, because you could potentially make it be at least some level of avoidability if you went deeper. But I would love to know if some of these had shallow wells.
I am absolutely going to look into that data. That's a great suggestion.
Andrew, I have a question that is sort of a question that's, we're very concerned, and we should be. It's a nasty group of chemicals, and we know that. But are we being overly concerned in the sense that if we were in Des Moines or Phoenix or San Jose or Austin, Texas, would there be a lot of PFAS in their wells and in their water and in their soil too? Is this not something that is exclusive to Nantucket?
It's a great question. It's something that comes up a lot. So first here, we're highlighting places that are within a certain distance of an exceedance of the Massachusetts state standard. Massachusetts does have one of the strictest state standards in the country, arguably the single most strict state standard in the country. It is an imperfect standard. The EPA standard is stricter. That one is also imperfect. But in many states, this is unregulated. A lot of states are still going off of the 70 part per trillion hazard advisory from EPA, which only looked at PFOA and PFOS. In Massachusetts, 70, you're almost all the way to the imminent hazard threshold. So this is a public health threat to the people of Nantucket, but it is also a public health threat to much of the entire country. USGS did a nationally representative sample of PFAS in drinking water wells, and they found that 45% of taps had PFAS in them. So Nantucket has a PFAS problem, and the rest of the state and the country does as well.
It doesn't make it okay.
Doesn't make it okay.
It makes it that we shouldn't be completely panicked.
If you are thinking of moving somewhere else because of PFAS, you might be in for a rude awakening.
Yeah,
If
but
you have
also
a
we are,
contaminated well, though, you should address that.
yeah, and we are a single source aquifer, so
Yeah.
once we lose that, there's no other aquifer nearby. So I think, in some ways, it's magnified, the intensity of the issue is magnified here because it's almost like an all or nothing type situation.
Yep. And the health concerns related to elevated levels and the risks of cancer. I understand it's everywhere. We have no industry. We brought it here. we brought this on ourselves. And I know this is my soapbox, but I really feel like we need to do what we can do to protect our community. There have already been multiple cases documented of people having cancer related to their PFAS exposure. So yes, it's everywhere, but like, I guess I don't care about everywhere. I care about here and I care about our community. And like, this is terrible. And people were told not that long ago in 2020 that their water was 12 parts per trillion and that was okay to drink. And we now know that it's not okay. No level is okay. So this, I think, is only going to get worse. And if people can't drink the water, then that is a huge issue. I feel like the health concerns and really encouraging people to get their levels tested in their blood to see where they are and know how to use that to monitor for different types of cancers or different diseases that could be related to this exposure. I just, like, what can we do for our piece of the world?
Yeah, it's very well said. We're trying to get the word out of widespread contamination. We want people to test their wells. I've started a PFAS newsletter. Last month's was about the importance of talking to your doctor about PFAS and had a little guide on how to prepare for that conversation, including testing for your well, looking at blood calculators, and bringing a few fact sheets to kind of advocate for yourself. So yeah, it's incredibly important.
Thank you, Andrew.
Thank you.
Madam Chair, just while we're on that topic, since we are at the mercy of Barnstable County Lab, and currently I think we are out of PFAS tests, samples. Tamika is constantly on them, trying to order as many as she possibly can. But I think this week we had 35 samples that were submitted to our office, and they usually come in boxes of 50, and that used to last us a couple of weeks. So things are going very quickly, but we just ask for a little patience until we, continually receive more samples from Barnstable County, because that's where they come in from.
Okay. Jericho?
Hi. I think I can do this in 4 sentences. I'm Jericho Mealy. I'm semicolon. It's a semicolon. I'm Jericho Mealy. I'm the new Deputy Health and Human Services Director. I'm giving a very brief report in Rocky's stead while he is at a conference. That was point 1. The town of Nantucket's Health and Human Services Department now has an Instagram account we intend to use for a variety of messaging, including some human service grants, as well as air quality and a variety of other public service and public health related messaging. There will be a study later this month that's the beginning of a 5-year study in long-term tick-borne illness prevalence, as well as ongoing symptoms for a variety of different tick-borne illnesses. And finally, the Health and Human Services Department received a grant from the golf club to supplement the childhood vaccine program. So we'll be reaching out to you. We should be able to source a variety of different vaccines for children who are currently missing, and then we'll be arranging that alongside Mary probably in the next couple of weeks so that we can get it going during the school year.
Status of community mental health survey?
We have received, I believe as of this afternoon, you're talking about the comprehensive human services needs assessment. That will be, I think we have finally just settled on a vendor. It is now the process of contracting. That's basically all it is. All of those plans suggest, all of the plans that were presented during the bidding process were looking at starting of primary data collection sometime 3 months after contract signing. So we're looking at October if we maintain that current tempo. And then I believe that's the major updates on that. Any other questions?
I think there was an article that, I think it was in the Globe. It was about the vineyard being overrun by Lone Star ticks. And the degree of illness and the percentage of those ticks that are carrying alpha-gal and the other thing that they carry. And I don't know what you know about what's going on here, or whether there should be some sort of, because I think people are very well aware of the deer ticks and the Lyme disease and all of that. But, and this is maybe not as serious, or in some ways it's
Alpha-gal-
more so, because it can really ruin your life.
Alpha-gal can kill you.
Yeah, so I wondered if, do you have any data on that?
So
If it's there, it's gonna be here shortly,
it's
in my opinion.
it's extremely fascinating, and I have recently found out that I am genuinely interested in ticks and tick-borne illnesses to a degree that I would not have admitted a couple years ago. Long story short, there are Lone Star ticks here. They are currently concentrated in a few small areas, generally in close proximity to Tuckernuck. The travel mechanism is assumed to be bird carried both from mainland or from Martha's Vineyard deposit, and there are high levels of them on Tuckernuck. So the areas on Nantucket that are generally associated with Lone Star presence is those in
West.
direct proximity to Tuckernuck, Eel Point, et cetera, et cetera. They've been recorded on the island for many years. They have generally been clustered in a few small areas. A point of interest between both the wildlife, or the tick biologist in Martha's Vineyard, and Dr. Sam Telford, who's doing that ongoing tick study, is why haven't they spread as quickly as they have on Martha's Vineyard, where it took about 10 years for them to be basically prevalent everywhere across the island, and the equivalent amount of time they have seen far smaller spread. We have started a variety of trailhead dragging efforts. We're going to be working with the conservation agents. There are always tick dragging experiments and data collection going on here. Anecdotally, people are seeing Lone Star ticks in areas where they had not previously, and we have had an increase in the number of reported tick-borne illnesses, less so alpha-gal, more so a couple of the other. I believe that we had increased number of BBiosis diagnoses this year, and then there was one other one that was ehrlichiosis, which I believe was being reported in higher numbers this year than in previous years by a notable margin, although there's some co-founding issues with where that disease was picked up and where it was reported. In general, though, it is safe. It is a safe bet. We're working with a couple of epidemiologists through a regional health program. They're going to be doing some messaging around alpha-gal in terms of symptoms, how to protect yourself against exposure to any of the allergy-triggering foods or products that might be coming along, as well as, I believe, expanding on like what the actual causal factor is. We have two regional specialists in that. As well as Dr. Telford, who is extremely well published in this field. And then we're going to be hopefully going into fall doing some more public service announcements, doing some more talks, et cetera, with people who have suffered it, as well as people who have studied it. So it's ongoing plan. Tick-borne illness now alongside is one of the bigger public health issues on Nantucket, and that's one that we're trying to focus on.
Well, great. I think that sounds wonderful. And I'm happy to hear that it's not, widespread here the way it is on the vineyard, and for whatever reason that might be.
I think it'll be academically interesting, but more practical is like what you need to look out for and what you need to worry about.
Yeah.
Madam Chair, per Jericho's comments on public outreach in the fall about tick-borne diseases, may I leave it up to the chair and vice chair to set the schedule, but maybe we could have a briefing on that, maybe from Professor Telford and some other experts on just like what the state of et cetera is.
That would be great.
I have 3 people who are well qualified and very willing to come out and do those kind of talks, either in person or via Zoom.
Good. Okay. Any other business?
Motion to adjourn.
Absolutely. All in favor?
Second.
Aye.
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 Okay. All right.